nip in the air.
There's one outside.
Was it? One right outside in
Yeah,
here?
but it's freezing in here.
I know, and then, well, there's these fans make it cold.
Hey.
All right, welcome everyone. Today is Tuesday, July 19th. The month is flying by. It's about 1:07 in the afternoon. You've tuned into the Board of County Commissioners work session, and we are now going to have a presentation on the Valley Health Alliance update with Kathleen Killen. Pronounce that correctly?
Killian. That's
Killian.
good. Yes.
Thank you.
Okay, well,
Please.
great. Well, it's great to see you all. I think it's been a year since we were together, and a lot has I'm happy to say, a lot has occurred since our last visit. Just a reminder of who is the Valley Health Alliance, the 5 largest self-insured employers in Pickens County. We're happy to welcome Mountain Family Health Centers. They're the newest member to VHA as of April 1st. And Ross Brooks, the CEO of Mountain Family, is serving on the VHA Board of Directors, so we're really excited about that. The covered lives, again, just a refresher, when you look at the 5 employers, and I can get you a copy of these as well. It's just roughly under 4,000 covered lives for total VHA. So the total employee count is about 2,000. The total dependent count is about 1,600, and then bringing us to a total, again, just right under 4,000 lives. And it's kind of interesting when you look at, I don't know if you can see this picture of my birds, but as you know, healthcare dynamics have really changed. So the old dynamic of employees receiving 100% coverage is actually, non-existent anymore. And what the VHA is really trying to do is blaze new trails, be very, very innovative, very creative, focus on evidence-based practices and utilization within this market. So why did the VHA, and John was one of the architects with Dave Ressler as to why we formed the Alliance, mainly to improve quality and improve the experience of healthcare for the residents of our community and VHA members, improve the overall health, enhance efficiency and reduce waste, and disrupt the status quo, which I think we've done successfully. We've shaken things up a bit, and then ultimately reducing healthcare costs. So here's our value proposition, and we're focusing on well-being. The term wellness is so 1980s. We're looking at the full person, mental health, physical health, dental health, spiritual health, and that's what the VHA is really focused on. And so we have several opportunities, or had several opportunities for improvement. When you look at, I'll try to get down here and I'll move the slides up. The VHA members over the past 2 years have reported stress, poor sleep, and weight management as their primary lifestyle risks. And then through the health fairs and through the data that we're getting from claims, high blood pressure, hyperlipidemia, or high cholesterol, and depression are the top 3 medical risks for this community.
Excuse me, Kathleen.
Sure, Mike.
Did they cite the source of the stress?
It's life, it's relationships, it's balancing work-life balance, it's commuting 2 hours to come to serve the economy of Aspen, not really being able to enjoy what Aspen and the Valley has to offer because they're working multiple jobs. So it's a very complex, set of human issues. The one thing that really stood out to me as a clinician when I got here was that at least 75% of the members within VHA did not have a primary care physician. And that's really troubling and challenging. Instead, they were using these big health fairs in lieu of having a mental home or a physical home or a relationship with a primary care physician. I'm really happy to say, and we'll get into it later, the county has really led the charge. We've actually flipped the percentages under John's leadership, and this dynamic is not existing anymore. Advanced imaging, CT and MRI, is about 35 to 40% higher in this market than in the national average. Depression, unfortunately, is 10% higher. The suicide rate, as you know, in this valley is 4 times the national average. And low back and neck pain are present in about almost 70% of the VHA membership.
On the suicide rates, have we ever differentiated, this is a horrible thing to say, but how many people come here to commit suicide that are not members of our community?
Yeah, it's hard.
There's a number in there somewhere where people come here. It's strange, they come to this beautiful place to end their lives. And I think we need to be looking at, not that we shouldn't be responsible, but I think we need to clarify that.
Yeah.
That's a fact that's always bothered me.
No, you're right, and it's very counterintuitive. It's a beautiful place, but the
Yeah,
economics.
People come here and they're not part of our community, and I think we need to be able to differentiate that, because we can't fix the ills of the country.
I agree with that, Patty, but I think we'll find it's a relatively small fraction. But
I don't know.
it's worth finding out. I agree.
Yeah, and just to let you know, the foundational elements of the VHA is really focused on promoting mental health. I mean, we know that's a challenge nationally, but more of a challenge in this community. And just I want you to be assured that we're really, really focused on those issues. You know, what are the things that are impacting our healthcare costs? So we look at the supply side of the equation, the high cost of care in this corridor, the lack of really seeking out centers of excellence. John and I have spoken about that, really working to identify cancer care, cardiac care, spinal surgical care, other what we call tertiary healthcare services. Pharmacy is a really big cost, and just the high risk management. VHA is not really focused on the supply side. We're not a contracting agency. So I'm not going out negotiating knee surgical prices and spine prices. That would be an antitrust because we're a 501c3. Instead, VHA is really focused on the demand side of the equation. So we're looking at utilization, poor utilization of primary care, 15% below the national average in this community. Overutilization, like I said, of advanced imaging, inappropriate emergency room visits. We have people going to the emergency room with the flu because they don't have a primary care physician, or going to their orthopedic surgeon because that's who they have a relationship with to manage their blood pressure or their diabetes. That is not an optimal care and efficient model of care. The high cost claims greater than $50,000, we need to really peel away the layers of the onion to understand what's going on there. Poor alignment with benefit design. We need to really develop the benefit designs within the employer model to really promote behavior change and provide incentives for those types of behavioral change. You know, until recently, poor evidence-based practices. You know, why are we providing PSAs at these health fairs for 23 and 27-year-old men? I had 38 women asking for a PSA when I finally told them it's not going to help you because you don't have a prostate. So we have an opportunity for community education and to really focus on evidence-based practices and then promote engagement. So this is really what we're focusing on as an alliance. Oh, come on. Here we go. And I'm happy to, so here we are. We're planning for change, and we're in the midst of this transformation and transition. Through the Mayo Clinic health assessment that the city and the county participated in, 68% of those that participated said they're ready for change. That's really, really good. 50% say that they're worried that they don't have the ability or the skills or the confidence to be able to invoke or sustain those changes. But they know where they want to focus their energies. They know that tobacco cessation, stress management, weight management are key to their health. And so therefore, our health coaching model is here to bridge that gap between the readiness for change and the confidence for change. And so we're really excited to bring Lisa and Gail, our two certified health coaches through Cooper Institute. Last year, VHA certified 33 coaches. We brought Cooper Institute here. We invited 33 clinicians from here to Grand Junction to come and to be certified to provide a level of standardization and excellence and a platform from which we can really start connecting the dots and engaging members. So the health coaching model, and we studied this for a year, we want to really touch 2,100 employees. Through about 800 individuals reached, through about 1,400 unique touch points, a phone call, a text message, one-on-one, face-to-face meetings, about 30 to 45 minute sessions, 15-minute follow-up calls, a dedicated 1 FTE, but we have it split between the two ladies. So Gail is working 30 hours a week and Lisa is working 10. And they're a great team, and we've worked with the employers. We have in place engagement plans and strategies for each of the 5 employers. Each of the employers have dedicated on-site days where the coaches come to the place of employment, or the coaches will meet people at a coffee shop, on a bench in town. They'll go for a walk with people if people feel uncomfortable meeting at the work site. So we're being really, really flexible in our model. And we have very ambitious goals. We're looking for 75% engagement with the health fairs and the health assessment this year. This fall, we will be launching that with open enrollment. We're really going to, drive participation with the health coaches. We want to reach 35% of the VHA membership. We want to reduce inappropriate usage of the emergency room, and mainly we want to connect people to primary care providers. Reduce hypertension, reduce metabolic risks, which means multiple risks, and we want to improve activation related to glucose and hypertension and cholesterol. The thing that's really troubling is when you look at the claims data, we have about 85% of our members with multiple risks, but there's no claims on them. And what does that tell you?
They're not treating.
Exactly. They're not seeking management or support or care for their issues. So we want to make sure that we connect to primary care.
Jordan,
Yes.
so Kathy, when you look at the engagement in health fairs, I saw a letter to the editor, a month ago or so. They were complaining about the
Blood tests?
Yeah.
lack of the lack of tests that ABH used to provide, and said are no longer providing. So is that good or bad? Or?
Well, this is really challenging, and it's a really great question, and the practices over the past 10 years or so have not been evidence-based. And actually the system that has kind of through inertia been developed in this community is giving you the exact results that you're getting. So what VHA is trying to do is systematically break down those elements that are not evidence-based. So going to a health fair, not having a primary care physician, getting 3 pages of labs delivered to your home with no interpretation is not an optimal model. And so we are, pushing the envelope relative to change, and it's more important for you to have that relationship with a primary care physician and have those discussions with your physician. We had people managing their lymphoma through health cares. We have people that are kind of health fair junkies that go from one health fair to the next. We have people that said that they haven't seen a doctor in 18 years and they're managing their health through the health fair. So that is not long-term an optimal model. And so VHA actually led the charge in really being courageous, and I really want to thank John and the city at the Jerome last year. I mean, we did a finger stick, and yes, it was limited, but Mayo Clinic, Cooper Institute, the CDC, NIOSH, they say that there's 5 metrics to measure total health. It's BMI, it's blood pressure, it's blood sugar, it's your lipids, and do you have a doctor, period.
But the finger stick doesn't do lipids, does it?
Yeah.
But not the full profile.
Not the full profile, but I'll give you the indicator. The conversation really stuck with me, and this was I think a challenging discussion, because intuitively, layperson like myself says, hey, 3 pages of labs and a full venipuncture is better than a more limited panel. So, tell me why we would make this change, because we're going to need to explain it to our employees. And a conversation that really stuck with me was one we had with Dr. Casey Chosewood from NIOSH, which is part of CDC.
Yeah.
And basically how he explained it to me was, look, you're actually increasing the risk to yourself and your employees doing the full blood sample when there aren't other symptoms that would indicate that those tests are necessary. And the example he used with me was PSA. A PSA test, just by itself without other symptoms, has a high false negative. And so if you go and get the PSA without other symptoms and it comes back with a negative or false positive, I get those reversed. Yeah, did a double negative, didn't I? But at any rate, that can lead to more invasive tests, which actually increase the risk to the patient over not having it except when there are other symptoms. And so they went through, and that's really what they're looking at is what is the combination of symptoms that would justify the test versus just having it and having that test then drive other more invasive, higher risk tests. And so that's how they narrowed it down to kind of the 5 indicators of health. And then those indicators should start to drive a relationship with a primary care physician. And every evidence-based study that we've looked at says it's the relationship with the primary care physician that provides the most effective, lowest cost health care in the long run.
Can I just tag on?
Yeah, please.
I totally understand that, but my concern is who's falling through the cracks now? At least there was a percentage that would do the 3 pages, see some abnormals, and then go to a primary care. There's people who did that, and maybe not everybody who got the 3 pages of analysis. But now I'm afraid people won't be doing it at all, so we're not even getting that number that would be seeking a primary care physician.
Yeah, and just to add on to that, before you respond, I think it might be good if we could have an optional expanded palette, that people could request and ask for more. I just think back to my physician, and they always ask for my blood profile from the last health fair. Either that, or they want to order a full one, which you then pay $600 or $800 for. And so that's the challenge, is that when you go to see your physician for an annual, they're like, well, where's your blood profile? And if you don't have one, I can't analyze it, and so therefore I'm going to order it at full price, so I can do a blood profile. That's a little bit of the dilemma that I'm seeing, because every time I go to my doctor for the annual, have you done your health care profile? Send it to me as soon as you have it. I'll go over it and tell you if there's anything of concern. And so I can see narrowing it down for both the cost savings on private policies and not. And then the second side that concerns me a little is that we have such a high percentage of Medicaid patients who have a hard time finding a Medicaid provider in a timely basis to look over those results with them.
Yeah. And so what all of the professionals are telling us is we're putting our community at more risk by doing that. And that's why we made that
Decision.
call. That's what the research is saying. And so we have that option. I can tell you, we weren't paying $600, for live. So there's probably another issue on the other side of those full lab draws and such. But the evidence-based practice really speaks to that. As far as I agree with you. Access for low income and Medicaid continues to be a challenge. Right now, our strategy has been supporting Mountain Family Health, which is also bought into this rubric as far as the blood.
Be tested.
Exactly.
Correct, yeah.
Michael?
So, I can see having a one-page deal, but you need to add 3 pages of available physician. I mean,
That's the rub, yeah.
you need to say, okay, this is your basic thing, there's some, and here are 3 pages of available physicians that you need to see. You need to choose one. And without that, you're letting people adrift, quite frankly. I mean, that would be my goal, is to connect. If you're going to reduce the cost, you have to still connect to the primary physician.
And so that's something that so 2 different populations we're talking about, because the Valley Health Alliance is covering the self-insured employer population now,
Right.
testing these out. And so, Mike, I think as you're going to see in a few slides, that's exactly what we've done at the county. Is we haven't attached the list of physicians, but what we've done is we've incentivized employees to go to a primary care physician with their health assessment results and such. And we now are, I believe, in the 93 to 95% of our employees are identifying having a primary care physician, whereas previously 75% had said they didn't have one. and we're seeing our costs drop.
So what you're
with that.
saying is, what we're talking about now doesn't affect the general population of the community, it only affects the population of these employers.
Well, I think the hospital, yeah, that's what the Valley
Yeah.
Health Alliance is
Yeah.
focused on. And I think the hospital in their health fair has gone to the finger stick
Right.
That's
also
what this
based on
letter,
the
the
national.
letter to the editor was saying, the hospital's
Yeah.
just trying to cut costs. They don't care about my health, they're just trying to cut costs, why are they not making
Yeah.
this available?
And I think they're using the same data in the hospital's defense to say, from a population health perspective, the evidence shows this is actually protecting the community.
Well,
But they haven't made the connection. That's the problem for most people. They haven't, you can take that test and you've got to make a connection to someone.
To the primary care physician,
That's
right.
the problem.
Yeah,
that's the challenge,
And
right.
Mike, I think that's a salient point. And to John's point, we need to decouple what the hospital's doing with their community strategy and what VHA is doing.
But we
Very,
have
very-
to listen to the constituency
Yeah.
Yeah.
as a whole. We don't
Yeah.
just listen to our employees. So a lot of our issues are broader than that.
Yeah.
The other thing too, which John said about a PSA, that if you had a
Yeah.
false positive or a false negative, whatever you want to call it, is that it's the physicians that are over, the physician should be the one that says, oh, this was your PSA from the health fair, let's look at your symptoms, rather than just ordering. We've got to put more responsibility on the physicians
Well,
for ordering more
yeah.
MRIs that may or may not be needed, or may not be needed, and ordering extensive put the patient at risk testing without doing an evaluation of their symptoms or lack of symptoms before ordering all that. So wouldn't put it on, I think the risk is created by the physicians in many cases.
Well, yeah.
And I think the physicians find that having the 5-panel gives them more ability to practice
Pick and choose.
medicine, exactly, and to really view symptoms and direct tests, rather than to have this, you don't know if it's a positive or a false positive or.
But
yeah.
Rachel's right, though, a metabolic profile is over $800 just for the metabolic profile. And all they do is run your blood through a computer that picks and chooses the buttons you push for over $800. And who can
Yeah, it's
afford that?
amazing.
Right, exactly. Well, Dr. Niebuhr is our medical director. He sits on our board and he is our main advisor. And I remember being here 2 weeks and he sent me, and he and I laugh about this because we're good friends. He sent me a scathing 4-page email I hadn't even unpacked yet about why are we doing these health fairs and why are we testing for uric acid and why. And I'm like, Dr. Niebuhr, I can't answer you, until we get in and know what we don't know. And so he's been a great advocate. And Patty, he agrees with what you said.
He's my doctor.
Yeah. Oh, there you go. So he agrees, and this is not casting aspersions, he agrees that the provider community has created, in air quotes, what he calls this monster. It's not just the employers, it's not just the community at large. And so the VHA is trying to be very courageous. And we have, to John's point, the support of Mayo Clinic, of Cooper Institute, of the CDC and NIOSH. I mean, you've got the 4 biggest evidence-based practices nationally guiding us relative to what's appropriate for population health. And it takes courage to make some of these changes. But you guys have enjoyed a $1.3 million decrease in total healthcare spend, which is what, 25% reduction? I mean, and John touts that he said that you guys were spending more on healthcare than road and bridge, renovation and construction. Now we're shifting the cost and reducing the waste and making those appropriate connections to really support the appropriate healthcare model and delivery model.
I think that's all great that we're saving money, but are our employees healthier? That's my concern.
Patty, that's a great
Yeah,
segue.
one second, please. You bring up probably the most important point in the background of all of this effort behind the Valley Health Alliance, and that is the containment of costs that then relates to the cost of health insurance. And, it's a separate topic, single payers in our region who are outside of this system. This is not ready to embrace everyone, as we know, because you're working with the self-insured and specific populations. But the rates currently are anticipated to go up at about another 25%, 25% for our region for next year for single payers. And Summit County has forwarded us a letter that they're sending into the Insurance Commission for us to consider a similar letter to mail as well. So, I want to see us do that to encourage them to scrutinize those rates even further and not grant them if they can find any reason that they're excessive. So, long way of saying, it is, these are the cost drivers that affect everyone. But at the same time, there's this balance of folks who may want to be able to track some of those changes in their body over time beyond the 5. And so I'm just wondering, is there a way to have an expanded panel available that people could pay more for those results? That this is what's recommended, this is a minimum, this will get you, it's good for your doctor's visit. And if you wanted to spend another $100 or whatever it is out of pocket because you're curious about these other ones, I mean, then you could. And I'll just leave that for you guys to look at and think about. But I do wonder if people could periodically do a full check as opposed to the quick check.
I think maybe the alternative way to do that, to have the right connectivity, because again, we're all lay people in this,
Yeah,
and
exactly.
Well,
but
some of you
perhaps, yeah, but fair enough. But perhaps that's something that individual employers or we as an employer could look at in our benefit design, so that if a full panel is recommended, it's not as much out of pocket. I think that may be something that we could look at, and that's another way. That way, if the doctor says symptomatically, you should have a full panel,
Yes.
you're not faced with that $600 or $800 question of whether
Yeah,
we should
so
do it.
let's just try to look into that variation on a theme.
Yeah, and I would recommend not offering a full panel unless you have a primary care physician, because
Yeah,
then we're getting
something like
right
that.
back to the same dynamic.
Yeah.
We're going backwards rather than forwards.
Yeah, that someone right then and there that the results should be sent to.
Right, and Michael, I think you made a really strong point, which I totally agree. If you look at the VHA website, ourvha.org, we have a provider section with all of the primary care physicians from here to Grand Junction. The coaches have been coached that whenever they meet with a client, to make sure they ask, do you have a primary care physician? Where do you live? Where do you work? Can I help you connect to those resources? And we also do that at the health fairs. So VHA is very much committed to making sure we make those connections.
I gotta say this. I saw the coaches, I saw some literature about the coaches. They seem so young, right? So for me, it's a little difficult to go to a young coach. 'Cause I'm thinking, what
They know about aging.
what can they possibly know about my situation? On the other hand, I read an article in the Wall Street Journal about Klaus Obermeyer, and he laid out his whole formula for a healthy life. And I related to that 100%. So I'm just saying I hate to, geriatric, I mean, to someone who's older, I think you actually need an older coach. You need to be able to say, we're in the same boat. And a young woman, I'm sure she's skilled and capable, but I just had trouble.
I didn't know you were as old as Klaus.
I want to be as old as Klaus.
Yeah.
Because he's skiing, and so it was a fantastic article. I recommend it to anyone.
So what does success look like for VHA, and what have I done over the past year since you saw me last? Well, here's what we've done. We completed and filed our 501c3 application in February, so we're pending and waiting to hear back from the IRS. We conduct annual focus groups with employees, with physicians, and with community leaders, and we take that information to the board, and we make sure that we develop our planning and strategies according to the feedback. We expanded our VHA membership, including Mountain Family. We have other suitors out there that are considering joining VHA as well. We're focusing on evidence-based practices. We implemented our health coaching platform. We have a mental health consortium working with all of the mental health providers in the region. We launched and developed our website. We have a VHA data warehouse working with Lockton, where we're mining the data and learning about the things that we know and don't know. We have a VHA performance scorecard that you've seen and you have a copy of. And last but not least, this is really important. We had Dr. Casey Chosewood from the CDC and NIOSH out in October, and he just came back in May and conducted a training, and VHA has been designated one of the 20 affiliates in the country. So when the CDC goes out and shows their map, VHA has a little star because we are implementing and assimilating the total worker health initiatives, looking at culture, environment, flexibility, and blending that with our other strategies as well.
Kathy, before you go on, so when you look at looking at expanding VH membership according to strategic priorities. What does that mean for other businesses in our community or in the valley?
Well, according to our bylaws, we're looking at large self-insured employers. We're looking at employers that have the same passion and commitment that the 5 founding members have, that will show up to meetings, that will participate in the working group, that will participate in the health fair process, that will participate in the health assessment tools, that will share data. We want like organizations that will blend in and work with us with our leadership covenants that we've established as critical.
So the key is, the first key is they have to be self-insured, which probably eliminates the majority of certainly small businesses. Correct?
Well, if I could add to that, I think right now, and I think that's the strategic part, and so I'll speak as one board member, not as a representing the total board of VHA right now, switching hats a little bit. I think the challenge right now is we're still kind of in a research and development mode, to try and figure out what works, doesn't work. How do we put the pieces together so that we can build something that in our community's context and in our providers' context actually is shown to effectively reduce utilization by improving health, to Patty's point, and actually saving some money. The reason we're focused on the larger organizations now is typically larger organizations have more capacity to take a little bit of risk in kind of a research and development mode versus in a small business. You usually have a pretty thin margin, and taking on that kind of risk is not really, you want something that's been proved out. So when as board members, we've talked about strategically adding folks on. Right now, while we're still in this development and figuring out what's going to work and what can we package together, we're focused on pulling those larger self-insured employers. I think as we start to thread together a portfolio of things that organizations can do to reduce utilization, then that can be made available to anyone to come in and purchase at a per member per month basis, just like part of a health plan. But so right now, I think the strategic part, George, is the idea is to make this available in a community asset, big picture, and that's why we've gotten on our nonprofit status. But we're focused on adding organizations that can take some risk.
So would a small business owner, would they benefit just in terms of utilizing some of the principles of VHA, for example, encouraging their employees to go to a health fair, and then to pick up a primary decision to discuss that? Would that, in the end, in the long run, would they see lower costs? It's hard to say.
And that's kind of the work that we're doing right now. I think it's going to take more than just doing those two things. I think those are the right kinds of things to do. I think what we're learning through our process is when at least the county's experience, and I think this matches what you see nationally as employees, if you've had low primary care utilization, if you all of a sudden incentivize employees to have primary care, your costs actually go up initially. Because what happens is, it turns out there's all sorts of things that you should be addressing and managing, but if you're catching them, your long-term costs tend to go down, and that's actually how our curve has tracked almost exactly. It went up, and then we've had 3 years of not only bending the cost curve, actually decreasing it, which is better than I'd hoped for. I'm sure we're going to see a bump up, at some point here, but I think once we understand better how all those pieces fit, then we can put something together that we can offer with more confidence to smaller businesses. And I think that's the goal.
Yeah, and one of the things that we learned from Dr. Chosewood, and this is really important, and you guys have all probably experienced this, your immediate supervisor has more of an impact on your health than your primary care physician ever will.
They create the stress, you mean?
Well, or the lack of flexibility, or a hostile work environment, or whatever. So we're really focusing, and this is where total worker health comes in, we're really focusing on training supervisors within the Valley Health Alliance to be sensitive to this and to look at empowering employees, involving them in the discussion, make them the primary work engineers for their workstations. They know more about their jobs than anybody can. And so this is really something that we're focused on as well. These are the questions that most physicians don't ask. The work you do every day really is a predictor of your health status and risk for obesity. And so the top two questions that physicians don't ask are, what do you do for your work 10 hours a day, and how are you sleeping? And so we're educating the provider community as well to make sure that they ask those important questions. We know that the high correlation to poor health at work, low decision latitude, poor support, repetitive work, heavy lifting, night work, shift work, poor instruction, emotional violence, discrimination, harassment, all of these things are intuitive as to promoting a unhealthy work environment. A correlation to well-being at work is
She
empowering.
skipped over prolonged sitting.
I noticed that.
Yeah.
Yeah, and we talked about with Dr. Chosewood getting you all standing workstations for your meetings. But we're really focusing
I wouldn't be
on
able to see over it.
on the well-being at work, so empowerment, enhanced decision latitude, engaging the employees in the conversation, et cetera, et cetera. And again, the two questions most physicians don't ask, what do you do at work and how are you sleeping?
Those things for the Board of Commissioners, isn't it?
Yeah. And so what gets measured gets managed. This is the 2014 scorecard. You have the 2015 scorecard. And it's really important for VHA to be accountable to each other and to track progress in three buckets. Risks. So Patty, it gets to your question, are we really improving the health of our community? Yes, we are measuring that. 2, engagement. Are people showing up? Do people have doctors? Are they learning? Do they know their numbers? And then last but not least, the cost side of the equation. So this is what our scorecard is meant to deliver. And I'm not going to make you blind, but this is just an example to give you a sense year over year in just 2 years. For the total Valley Health Alliance, we've reduced gross cost by $33 a member. So that's right around $120,000. To your point, Rachel, earlier, we've mitigated CPI 3.1%, and we've mitigated medical inflation, which is 9%. So even if we're holding flat, that means, to John's point, we're starting to bend the curve and we're neutralizing for inflation, which is really important.
Yeah. Before you go on, we are going to take this one till about 2 o'clock. We were running a little late this morning for the next item up in the back. And I guess I should probably say it now. I'm just wondering, isn't there potentially an expanded role for Valley Health Alliance? Kind of what George was asking, but not as directly as being members of Valley Health Alliance, but that the Valley Health Alliance participate in this ongoing discussion we're having with the state about cost containment and hospital costs, and because I'm afraid we're going to get all this work done for the members, and I understand the need for a group that has the same baselines and interests. But if the costs at Aspen Valley Hospital keep going up because they're losing more patients who go to Denver for cheaper care, it's a very negative cycle. And even when we come back, obviously, as we should, to community health, the rates have gotten so high that more people are choosing to pay the penalty and not have health insurance at all. Yeah. And we're getting into a really negative cycle that way in our region. And so I just wonder, right now it's been me going to testify and Nan or Kara putting together some talking points. But, isn't there a role potentially expanded for the Valley Health Alliance to participate in those dialogues and those discussions so that we don't get eaten from behind as the rest of the region's prices go out of control. So I'll just leave it as a point for John, and you think about it. George, if you have a comment.
To go back to your unless you're on the same.
No, go ahead.
Going back to this previous slide that we had, Kathy.
Okay, sure.
It's hard to read on that, but I'm just looking at the one in our packet.
Oh, the scorecard?
The scorecard, and I'm just, under the first one, I'm just looking in terms of Pickens County. And the numbers are a little alarming because our member count is, here is 420, which is on the lower side, but our total claims, I don't know what PMPM means, but that's quite a bit higher than the others. And when we talked about the two of the most important things in terms of what do you do for work and how are you sleeping, I was surprised by the number of scripts written for depression and sleep.
Right.
Pretty much across the board, not just for the county, but except for the ski company.
Right.
So those are really pretty alarming numbers.
And they were much higher, and so we're now catching up.
Yeah.
And so we're doing a better job there, and it hasn't been through benefits cuts per se. You know, we haven't had big changes there over the past few years. We've had some, but it's really been a utilization decrease. But you're right, there's still a lot of work for us to do, and I think there are some alarming numbers.
Yeah, I mean, back to your earlier point, I mean, it just seems like in terms of physicians and that's, I think this even on a national level, been criticized in terms of too quickly, too easily handing out scripts instead of trying to deal with other problems, whether it be diet, exercise, sleep, but the easy solution is let's just give them some scripts to some sleeping pills and take care of that problem. But they're not really taking care of the problem because the underlying issue is being caused by their diet or lack of exercise.
And that's one of the reasons we trained so many health coaches. So we're utilizing 2 for the organizations, but we train 33, and those folks are embedded with providers throughout the community. And so we're having those discussions with the provider community and trying to provide resources because, you know, and this was kind of a learning curve for me too, as we've been meeting with the primary care community over the past couple of years. You know, it turns out that the training hasn't necessarily been directed at this kind of coaching or even good linkages between physical and mental health services. There hasn't been a good integration in training, and certainly not a good integration in terms of service delivery models. So instead of trying to change that with the docs, we're trying to have tools and better connectivity. You know, it's helped a lot for primary care physicians that serve our employees to know there wasn't one that knew we had a employee assistance program where folks could go and get free counseling if they were under stress or what have you versus, you know, trying to be treated medically. And so we're trying to create those bridges now and see how we can have a better integration. But you're absolutely, I think you've hit the nail on the head, and the problem is a bigger systematic problem than I thought it was when we started talking about it.
And that's why the scorecard is so important, because we didn't know what we didn't know. And for example, if you look at Pickens County for 2015, I mean, I would love to reduce 15.9% non-emergent emergency room visits. I mean, why are people going to the emergency room when it's not emergent? So how can we design the benefit design for the county to disincentivize people to just show up to the emergency room when it's non-emergent? Patty, to your point earlier, Dr. Niebuhr says, and Dr. Schur says, you know, they have employees coming and they may have a first-degree knee strain and they want an MRI. And Dwayne will say, you're not a candidate for an MRI. And the employee will say, well, my employer's going to pay for it. I want it. So how do we disincentivize those non-evidence-based behaviors to change utilization but providing the appropriate access? Rachel, to your very strong points, we have been recognized by the Colorado Business Group on Health in Denver. They have 400,000 members, and so we're being looked at as an incubator for the changes that we've made in a very short period of time. So we are getting state level exposure and requests. We're unique because we are focusing on the demand side of the equation.
Yeah.
Most people just go for price. Price is a one-hit wonder. The long-term benefit is really going after appropriate utilization. But we've gotten calls from Mesa County, from Colorado Springs, from Gunnison, from Montrose. They want this model. They want to build a VHA in their individual markets, working with their employer. So I think we have a platform where we can not only improve the health of this corridor, but really help at the state level with
Yeah.
employers as well.
And I agree with that as well. I mean, naturally, that's why we even embarked on this effort.
Right.
But it goes a little further in terms of, again, being able to testify at the Cost Control Commission or offer suggestions there and things like that. But Steve?
Yeah, different comments have touched on the fact that, this is just the main employers in the valley. And looking at a long-range vision, if there's any way we could bring in all the private employers in the valley into this through some mechanism, which I have no idea what it is. This is like a long-range vision, but to have the results we're getting and be able to have it spread throughout the whole upper Roaring Fork Valley, I think would be, to me, a vision of where we want to go ultimately. Now, I realize there's a lot of hurdles to get there, but if there are any opportunities to expand, to bring in other employers, or to make a mechanism where self-employed people or small companies without the same type of health insurance plan could get the same kind of benefits from what we're finding out. And to me, that'd be our long-range vision where to go.
Well, John and I are leading a strategic planning session with our board, the VHA Board of Directors, on July 29th, a full day strategic discussion based on what's our growth, what should our board composition look like. We've got RAFTA who may want to consider joining. We've got the Roaring Fork School District who may want to come with 1,200 employees. So to John's point, we're in R&D, but we're starting to see some proof of concept early on. And so yes, the board will be addressing those kind of long-term growth discussions. But here's some good news. It's not all doom and gloom. It's very, very challenging, but here's the good news. And Patty, we have improved connections to primary care. We have overall improved the risk stratification, and I'll be very specific on the next slide. Physical activity, sleep, stress, and weight loss saw some improvement over the past couple of years. Rachel, I know you asked my last visit about A1C. A1C and blood pressure risk also saw some improvement. 68% of the population is planning to make a change. That is important. People are ready. The VHA coaches will help us build that confidence for members. And then again, Pickens County has enjoyed, a reduction in total healthcare spend. So the lessons learned is transformation is not for the faint of heart. It's very challenging. What we're doing, if everybody else had the answer, we wouldn't be struggling. But we're making some headway, and it takes discipline. We need to be prepared to face resistance, and be resilient as an organization. We need to really look at the data, and that will serve as our compass, if you will. So that's pretty much a year in summary. A lot of work, but a lot of progress. And I'm trying to find that slide, Patty, where I can be very specific relative to Mayo Clinic.
What was your statement, white knuckles? What?
Oh yeah, white knuckles are normal, clenching your fist. Where is that Mayo Clinic slide?
I think accessing the
Here you are.
opportunities with Mayo Clinic is huge, but.
Yeah. So here's the 2-year cohort trending data. This is from Mayo Clinic. Kathleen didn't make this up. So in red, those are the good numbers. Those A1C, alcohol consumption, blood pressure, we've moved the needle. Nutrition, physical activity, sleep, we've moved the needle. Tobacco and weight management, we're starting to move the needle. The green ones we're still struggling with. Blood sugar, HDL, LDL.
And so those have gone up.
They've gone up. Now here's the thing that doesn't worry me, Rachel, because what do you think that tells us?
More people are getting the information.
Exactly. So that is a good thing. The thing that concerns me, and I think to Michael's question earlier, is our stress is flat. We really need to start looking at how to improve and impact the stress within the environment.
Alcohol rates have gone down.
Yeah. So Patty, to your point, we're starting to bend the curve relative to cost. And even in 2 years, we're starting to see, through knowing your numbers and all the campaigns that we're doing, we're starting to see a shift in health as well in a positive direction.
further questions or comments, board? Michael?
I looked at the website and I looked up the physicians and, great, it's wonderful, you're 91 physicians, great. But there's a lot of numbers and code in there that I have no idea what it is. You know, so I suppose it's their registration number and stuff like that. So the list just needs to be, I mean, for me, it needs to be less of a technical document and more of like, you're welcome here.
And hard copies available rather than
Yes.
always
Yeah,
listening
on the
people go to
website.
their computers. It's easier if it's in front of you.
But yeah, it's wonderful. I mean, I'm great. But now that connection has somehow, and it's in a 3 or 4 steps away from the primary information that's on the website. So, you know, it's just, it still needs to be tighter somehow.
And different employers are doing it differently. So for example, we're offering a cash bonus for employees to go and establish that relationship, and that's been pretty successful. I think some of the VHA members haven't incentivized employees, and their engagement is showing a little bit lower. And so it's going to be, for the community, I think what we may need to do is, you know, that can be a conversation we have with the hospital, just to suggest, you know, that at the health fairs or such, having a list of primary care physicians and contact info,
Right.
which they may already have available and just not handing it out. I would think that's readily available even at the hospital.
And does the finger test, what does it do actually for lipids? Does it do HDL?
Yeah, it does all your lipids. So it does total cholesterol, HDL, LDL, and triglycerides, yeah. Now, the issue with the finger stick is there's a 2 to 6% variance. But again, this is not, these health fairs are screening opportunities. This is not disease management. You shouldn't be coming to a health fair to manage your lymphoma. I mean, this is a screening, a high level, know your numbers, the 5
Well,
top
health fair
measures of
doesn't
health.
manage your lymphoma to begin with.
Well, I mean, it's sad that people don't have physicians and they're going to the health fair to manage their white blood cell count, so. But engagement, to John's point, this is where we're going to be successful. The more people we engage, the more people that show up to health fairs, that engage in the coaching model, that take the health assessment. Rachel, like you said, we're identifying more risks and people are becoming more informed, therefore they can be more empowered. But the challenge is, when you look at the claims data, we have 18 to 23% of the people, because we cross-reference the health fair data and the health screening data with the claims data. Like I said, they have multiple risks, but no claims. We have to find those people and connect them to resources.
And then is the little blood stick, is that AC1 or just daily glucose?
No, so what we do with the blood stick is that if your blood sugar is hovering right around 100, then we'll send out an order an AC1 or A1C for you.
Additional, okay.
Yeah, because it doesn't make sense to order an A1C if your blood sugar is normal. So we use 100 as, you know, kind of the line in the
Baseline.
sand, right? And thank you for that feedback, because I heard your feedback and we made sure that we implemented that at the last health fair.
Yeah, okay, great, very good. Any other board questions or comments?
Is there anything that you, based on the presentation, I would really like a takeaway? Is there anything that you think we should or shouldn't be doing, or you think we're on the right path? Any takeaways I could share with our working group, or I could assimilate into our strategic planning discussion with the board on the 29th?
For me, it's just about being more involved at some level, you know, even though it'd be an adjunct to the primary mission of involved in what we can with the Health Insurance Commission, the Cost Control Commission, and single payer policies. Because, you know, we are sitting as the Board of County Commissioners today. We also sit as the Board of Health at other times, and so community health is very important to us, and how other people are getting covered. And it just seems like this would be a bit of a natural resource. And additionally, I don't want to get crosswise with the members of Valley Health Alliance. When I went to the Cost Control Commission and advocated they really look out of the box at new ideas, such as hospitals that don't have a certain number of physicians willing to take Medicaid and Medicare patients start denying those physicians admitting privileges, or that if hospitals don't take have a certain number of doctors who take Medicaid, Medicare patients, that they lose their nonprofit status, that the hospitals that aren't working to control costs as well and see people healthy don't no longer get the hospital provider fee reimbursement. and things like that. And so, I think they need to start working on some more disincentives, but that might upset some of our partners, say, at Aspen Valley Hospital. I don't know how that impacts them, but the state is going to start turning the dial as well. And it's better for us to be ahead of it and these providers to be ahead of it than to be caught flat-feeted and just down at the legislature saying, no, don't make us do that. I want to make sure they have the heads up and we have some sort of understanding that we're equally working on cost containment for the general population as well.
Absolutely. And Steve, I think reading between the lines of what you were saying is really important, because as we move down Valley and we bring in employers out of this market but on our corridor, we have to talk to other providers. Our employees don't live here. They live between Basalt and Parachute. So we have to look at access. Maybe, Michael, to your point, primary care, this is why Mountain Family is so important, because most people, the studies show, most people want to stay within 7 to 10 minutes of their local geography or their home for basic care. Now, they'll travel with a really sick kid or a high-level cardiac or cancer care, but most people want to stay in their neighborhood. So we have to look at capacity and opportunities within the regions where our employees live. So as we migrate down Valley, we need to really have strategic discussions about that, which we will do on the 29th. But I want to thank you all. I want to thank John. John has been a great visionary. We need a visionary at the helm and driving the boat, and I just want to thank you for your support and your leadership, so thank you.
I think Michael has one last comment.
Just on your website, you have the 14ers Conquer Your Challenge. And it just occurs to me that if you're in, most people aren't climbing 14ers. And so if you put it in that phrase of a 14er, people are going to back away. That would be, if I were in poor health and suddenly to join your flexibility or your know your numbers or your body mechanics, and it just makes it too much of a challenge.
It's too intimidating.
It's too much of it. So
For those who
you
aren't
need a
athletes.
more inviting kind of thing. This is not a 14er.
Like walk
This
the
is
bike path.
something else.
Yeah, it's interesting because we've
We're
got.
going to have to go on
Okay.
from that comment. We'll just
Okay.
leave it at that. But thank you so much
All
for
right,
that.
thank you.
Okay.
Thanks, Kathleen.
Really appreciate it. And we'll just take a 2-minute break while we set up with the new PowerPoint or whatever you have for us, Brian. we're back on TV. Thank you, Grassroots. It's Tuesday, July 19th, about 2:11 in the afternoon, and we're now going to go on to a discussion of our Energy Code addendum. You're up.
Thank you very much, Director. Again, if you've forgotten who I am, I'm the Chief Building Official, Brian Paul. I've been meeting with the board in a series of work sessions discussing...
We only have 10 more to go.
Yeah, possibly. And this is an extra short one, so I'm really going to have to up my game as far as getting through the slides. So I'm gonna have to keep
This is a
focused.
short one?
Well, we only have 45 minutes today.
Oh, the meeting is short.
The meeting is short. I wanted to start, I pulled up the agenda item summary. I just wanted to run through a little bit of the history and go over last week's issues that kind of come up that we could discuss as far as direction from the board and see if we're on track with working towards the final draft. As I stated in the issue statement, the purpose of this work session is to discuss the Energy Code addendum. The background, the Board of Commissioners met with us on June 28th, and we got as far as the mechanical system slide. Then on 7/12, we continued from the mechanical system slide on to the REMP review slide. And today we're going to continue the REMP discussion, and what I've prepared in the REMP PowerPoint today is some of the background history of how REMP got to be where it is today. And then it's just going to be open for whatever time we have remaining today to just kind of go through a discussion of direction and ideas and concepts that we'd like to incorporate. And then we hope to come back on August 9th, another work session to kind of compile these first 3 work sessions directions into one cohesive discussion. So on the recap of the 7/12 discussion, I just kind of picked out a few high points. We discussed E-Star appliances as far as that portion of the sustainable construction or energy efficient side of things. And we decided they'd either be required or incentivized on some level, and that maybe we would have quantity levels based on the size of the home or different ways of looking at it. So we're going to bring some proposals as far as incorporating E-Star appliances. We definitely discussed minimum efficiencies on the boilers for new construction, and we'll in that broader discussion of remodels and how to handle the requirements for remodels, we figured we would incorporate some kind of requirements for upgrading and bringing those older systems up into current compliance. In the commissioning discussion, we talked about that it didn't seem necessarily if we had a properly sized engineered system, or if we went to the total BTU approach as far as quantifying. But my consultant answered back on that when I wrote this and sent it out, that he sees that system commissioning has a greater impact on efficiency than proper sizing, second only to the system layout and location of equipment, and that proper operation of complex systems is the single biggest issue in the field today from his perspective. So if we want to reopen the commission discussion, we can bring that with our future discussion for the final ordinance, and we can put some options in there of ways to address that.
Board, I think that would be a good discussion for the final review. Do you agree, Michael? I know that was what.
Well, but he also says that it wouldn't be critical if we take a total BTU. So there's sort of...
Well, I said that, but I wrote a quote from my my consultant when he responded to me, and I'm going to try to get him here.
And he refuted the...
He really felt like commissioning was an important component and wanted to bring that to the table for our next discussion when he's able to come.
Are there even, well,
I
mean...
So we'll have the discussion again.
It's just a question of having qualified people to do the commissioning, and that...
Yeah.
Correct. There are some background things that we'd have to get into place for sure to make that work appropriately.
Yeah, and maybe there's a version of commissioning light, that is a double check of are they running right after we've done the BTUs as opposed to something bigger. I don't know. That's your area for that discussion.
And it could be maybe the designer just gives a final report that everything is up and operational based on the standards they used for designing the system.
Yeah,
I mean,
or something. So
simple.
we'll take a look.
Okay, thank you.
Obviously depends on the complexity of the systems. There
And
might
then
be a
that's what he said.
threshold that passes over and under.
The more complex it got, the more important that commissioning component becomes, is what the consultant's perspective was. The next one was sealed mechanical rooms. We felt kind of in general that it should be a requirement, but it needs to be addressed. The latent heat component was something that Michael had brought up, that if we don't deal with that, then they open the doors anyway, and it doesn't really stay as sealed mechanical rooms. So in our proposal, we'll incorporate something that addresses both of those issues of sealing the mechanical room itself to avoid that carbon monoxide leakage, but addressing the proper way to ventilate those spaces and make sure that there's not a temperature issue in those mechanical rooms. The next one is including provisions for pre-piping, pre-wiring for renewables. We felt like that was something that we'd like to see incorporated into the final draft.
Ryan, could we have
Sure,
the
ma'am.
EV charging?
What's that?
EV charging.
Electric vehicle charging? That's actually in the code, and I think all we'd have to do is
Marriott's now pulling.
Bring it forward.
bring it forward as more of a requirement than an option.
Okay.
It's in the electrical code, it's in the energy code, but we could maybe address that, but
And that's the pre-wiring for it, it's not the requirement for an installation?
correct.
Okay, thank you.
Number 6, the job site waste, construction parking, material separation, deconstruction, all are critical sustainability components that we'd like to address in the future addendum. And Kathy Hall from the landfill, we had an email discussion, and she's starting to work on that white paper that was commissioned on the feasibility of reuse of the construction materials and deconstruction components. So hopefully by the August 9th meeting, we'll have something for you. If not, definitely by the time we come forward with the actual draft. Number 7, most of the sustainable methods brought forward from the efficient building program are worth including. So that was, we could look at that list again, but I'd really like to get onto the ramp, so I'm just trying to run through this. Plumbing fixtures match the state. The difference between a low energy greenhouse and an energy consuming greenhouse or metal building type greenhouse should be looked into further. Marijuana grows, we'd like to consider maybe a REMP offset because of the fact that they really cannot be built in a better energy efficient way and not start having to compromise the passivity and the open ventilation and some of those other requirements. So we're going to have to maybe be creative in our approach towards how to handle grow operations specifically. The total BTU approach was addressed, and we can look into that more as we go into the REMP side of things and make sure that we are covering everything the board would like to see in that approach. And August, my consultant is going to work with us. We're going to do some roundtables after this meeting. We're going to meet together and kind of regroup and come up with our concepts of what we think we heard from the board and the directions we'd maybe like to take around and come and bring that forward in our 4th discussion as far as where we'd like to compile this whole addendum. And then the introduction to the REMP discussion was the final part of last meeting. So we can move into the REMP discussion if there's no further questions about those items.
Okay. I don't think that was a good recapture of our
Yeah,
previous
it's really
discussion.
helpful when you do that.
And do you feel like I captured everything that kind of was the high points at least?
Yeah.
Yeah.
Okay. So, this is, wow, that's,
They're taking apart the building.
they started doing a demo, didn't they?
We're deconstructing the building over.
We didn't know we had our permits yet.
Yeah, watch the file cabinets to come out the back window.
This is our last meeting in this room.
Wow.
Yeah.
So the August 9th one will be across the street.
Yeah, library. Okay.
That's a beautiful building, a beautiful addition.
But we're gonna open up all the doors and really screw up the HVAC system.
That's
Yeah.
true, ventilate. Before we get into the REMP, I wanted to point out, I did incorporate this cost study. I'm not prepared to go into detail on that today. We'll definitely have that more prepared on the 9th when we come forward with. But I wanted to kind of have a better grasp of those numbers. But I offered it up to the board to kind of go through and review and start preparing for that meeting and actually kind of look at those numbers that we got. And those are from the federal government, so hopefully they're true and accurate for Colorado. Okay, so the REMP, where are we now? And where do we want to be, is how I titled this PowerPoint. The brief REMP overview. And this is a quote from August Haas, my consultant from RAG. And it says, the intent of the REMP program is to encourage on-site offset of energy used for exterior energy uses including snowmelt, pools, and spas. If a project opts not to install a renewable energy system on-site to mitigate exterior energy use, a fee equivalent to the cost of offsetting that energy consumption for a period of 20 years is to be paid into the REMP fund. These fees are to be used to install renewable energy production in other locations. So that is what a consultant looking at our program and working with it, he does work in this area and does use our REMP program to help his clients. That's his perspective on how he sees REMP, what REMP does today. And so if we start right there disagreeing with that assumption, that we may need to talk about that more, but that's
Can
the
I-
initial assumption.
Yeah, Pat.
Well, don't we use the fees for more than to install renewable energy?
That-
We
that's
use
what
it
I was-
for light bulbs, we use it for.
Efficiencies.
Yeah.
Yes.
So I
That's
think
what
that,
my
and,
comment.
I mean, that was one thing that jumped out at me, and I think the word exterior, even though it might be right in here, I think we want to start looking at interior also, so.
Well, that's true. That this is
Yeah,
this is what
this is-
this is
that's
today.
where we
This
are.
is current. This
Yeah.
is where we are. Right.
Michael and then George.
Yeah,
Oh.
you know, my feeling was that the REMP was put in place to actually, to encourage those. But it's, the problem is that you can buy your way out of it. We never thought people would buy their way out of it over the long term.
Right.
We thought that people would learn to use renewables in their project. Now it turns out, whatever the cost, pay, and so that doesn't really work for me, quite frankly. People aren't, so they, I don't know.
Well,
There's some injustice in someone who can afford everything, including whatever it takes in terms of gas, electricity, REMP offsets, and everything. We haven't done a thing except offer a price for it.
Didn't we have a report not long ago about how many did choose to do at least most part on-site and off-site? And,
Yeah.
and it's not 100% all buying their way out.
No,
It's a
I don't
big-
think it wouldn't be because you have different sizes.
Right,
Yeah, projects.
40%, over 40% pay, actually mitigate entirely on-site, and then up to 75% that are, that would have to participate in rent, they offset some of that excess, that exterior energy use.
You know, the thing that strikes me about our definition and the current program, which might be worth renewal or looking at, is whether there would be an additional fee at the end of a 20-year upon sale of the house or something. Not, you know, A, the 20-year period, and then B, it has to be a new set of owners that are now would be paying for their excess energy use or have the opportunity to install new efficiencies and new energy production on their site. So I'd like to at least look at that for the second one, because the energy use will go on for more than 20 years. If the offset's just good for 20 years.
Also, as we go farther into this, there's something I didn't realize too, is that when REMP was originally set up in the 90s, it was set up at a 2-for-1 ratio too, where you get better credit if you use offsets than if you use cash. And I don't know if people realize that they could actually get a better exchange for doing the renewables. I don't know if that's spelled out so clearly that that's obvious to people, that there's a better incentive to actually do the renewables. So we'll, as we get deeper
So you
into
mean
this,
you're only offsetting half? Is that what you're saying?
basically, you're getting a 2-for-1
Right.
on a renewable. Yeah.
So if you do your renewables on site, you get more credit than as if you pay in lieu.
Yes, that is correct.
Yeah, we pointed that out, I think, in that study as well.
Well, perhaps that's even a ratio that should be looked at.
Yes, that's for sure. Okay, so we do have some trouble with the definition, and we'll try to kind of, Clean it
Just
up.
to further that conversation, that's interesting, because if that were the perceived case, then you'd actually have much more people doing it on, I mean, in theory, you'd have many, because it's a much better deal. So it actually doesn't prove out that way, right? The usages don't point to that. It should essentially follow the same ratio. Well, why is that? We don't know.
this is what I'm trying to divulge in this
Okay,
process.
okay,
Looking-
sorry,
Looking
sorry.
back,
Yeah.
because I think that we need to have that conversation. We really do. I think we need to know why, and is that what we wanted to do? I really think that that's the important part of this presentation and this discussion, is to understand, is that what we meant for it to do? Did we mean for it to really incentivize people more to do the renewables? And if that's the case, we should broadcast that a little better and maybe
just
focus
didn't
on
know.
that. And so I think we're going to reveal some things as we go through this that are going to help us with the ultimate discussion.
And after our conversations, you may have already had some, but it seems valuable to talk to some of the architects in town about their understanding of REMP and what type of recommendations they make, or why do their clients choose this or that. You know, I just, some insider knowledge would be helpful.
Absolutely.
Okay?
So our REMP, residential REMP, the fees for 1 square foot of exterior energy use are currently, and that's assuming 100% efficient heat source or heating source. Snow melt is roughly $34 a square foot. When we first brought the program in, it was about $16, so that has increased over the years. It's now at $34 a square foot for snow melt, $176 a square foot for the surface area of a spa, and $136 a square foot for a pool.
So that's the offset that you're
paying.
calculating?
That's how much you would pay in
Mhm.
per square foot for your pool. So if you have a 1,000 square foot spa, you'd spend
Steve,
$1,300.
do you have a question on that?
Brian, the R ramp and the C ramp numbers are different. The C ramp are paying a lot more for snow melt and pool.
Yes.
And why is that? I saw a figure in there that they're using less, but there are more people benefiting from the things, and they're having to pay more for it. And I don't quite understand the logic there.
The original decision point behind that, that I could get from the city side when they made that decision, was that they felt like it was more constantly used, and the systems were running more, and so more energy was being consumed ultimately. So it was based more on the fact that you're always snow melting your driveway and your walkway at a commercial building, as opposed. But then they also do some trade-offs where they give some life safety allowances within the city, because they have more public ways and driveways and stuff that they're dealing with. So I think it hopefully balances out to a digestible degree. But that's the argument, is that these systems are run more often. That the pool in a home is, well, actually pools I think are the same actually. Let's go back. Yeah, pools and spas are the same. It's really just the snow melt.
George,
George, you have a question?
You're talking about the commercial ramp though, or the, you're talking a commercial ramp difference?
The commercial ramp rates are higher
Right.
for snow melt and pool,
Right,
not for
okay.
spa. They're the same.
Right.
George, you had a question?
Yeah, a couple. What do you mean when you say spa?
A hot tub, basically.
What-
A hot tub.
Just a regular small hot tub?
Well, we give an exemption for one package spa that's the pre-motor's already installed and it's already pre-insulated, and you buy that off the shelf and they deliver it and you start that up. We allow you to have one of those without having to pay rent towards that. Now, when you start having more than that, the city has a different philosophy. They allow as many of those insulated pre-packaged spas as you'd want to put on your property. The problem with that is you start getting into surface area and evaporation, and that's kind of one of your major heat loss factors in spas. So if you've got 6 spas going as opposed to 1, now you have that heat loss and that surface evaporation where you're really using your energy, and those systems are running all the time. So we exempt 1. After 1, you start paying into the rent program. So.
I'm also surprised that snow melt is that much lower in terms of offset than even a hot tub spa. I mean, what we heard was even investing in our off-site solar panels through Collective, the amount that we are purchasing, all that does is offset our snow melt at the underpass. So it seems like this is such a really low number for the energy that is used on a snow melt private driveway. I think we should look at that.
We're going to get. I'm building towards the formula. When we get to the formula, we can really start picking
Also,
apart.
one's electric. The problem with underpass at the airport is it's all electric heat. So that's a different heat source than, say, a gas heat, which in these driveways are going to be typically hydroponic, not electric. So the electric's the absolute most expensive way you can do anything in terms of heat.
Okay, let's keep moving because we're going to bog ourselves down. Go ahead.
I was going to
Quick-
say,
quick
I was going to say
answer.
one last point on that though. But on electrical energy, you get 100% one-to-one trade-off for BTUs put in to BTUs being used to melt the snow. So you get kind of a reduction of producing the gas and burning the gas and then the production. So some people argue that, well, electrical is more efficient because there's 100% exchange one for one for putting in the energy and expelling the energy and consuming it. So, but those are all deeper things we could really spend all day on. And I don't know if we.
That's where we're going to move on.
really want to do
August
that.
here.
Okay.
Yeah,
thank you.
he will be here next week. Or August 9th. August will be in August.
I will be here next week.
Yeah, on the 9th, he'll be here. Yeah. Renewable energy, that's true. Mitigation credits in the REMP worksheet are identical for C and R REMPs, meaning the trade-offs are the same even though the dollar values are slightly different, which is one point that we could look into is should there be a different renewable trade-off on the C REMP side? Does that make sense that they're identical? If you look at solar hot water, you get 224.65 square feet of installed solar hot water panel. That is your trade-off on how much it applies towards your dollar payoff. And the consultant seems to think that that is the most incentivized of the three options, that the trade-off for solar hot water is actually a better trade-off than solar PV. But then if you look now, solar PV panels are actually less expensive to buy than they were a few years ago or when we first put this into play. And they are more efficient than they used to be back when we first put this into play. So there's reasons to revisit these multipliers as well because things have changed over time. And do we really want to put the most emphasis on solar hot water when it's not the most efficient of the three options?
It's the least used too. I mean, nobody
it's-
uses it.
And they seem to break down and not be put back into commission.
Mona?
It is least used. I will make the argument, though, that it will reduce your use of natural gas, and we have a higher incentive for solar thermal as a way to help support reducing natural gas and supporting the Thompson divide.
So,
But solar hot.
Even though there's not a direct connection with gas potentially coming out of the
Yeah.
Thompson divide, but there's a direct connection in terms of using natural gas and further drilling and development.
Yeah, well, we could ban use of natural gas too, so where would that get us?
yeah.
We also give them credit as if they're getting 100% output, which means that they'd have to be able to utilize that hot water year-round, which means even in the summer, when they aren't melting their driveway, they need to have some purpose for that hot water or some way to store that or some way to utilize that hot water to actually be as effective and as efficient as we're giving them credit for. So those are some background confusing parts of this that I really wanted to get a handle on because we're giving them in exchange for something that if it's not really working at its 100% effectiveness, it's really not worth as much as we gave them in value in a trade-off necessarily, unless we feel comfortable with the way this is designed and we can keep going the way it is. But these are some of the confusing components that this consultant's hopefully going to help us really dig into and be able to really kind of
You know, for a house
Fix if they're broken.
that's radiant heat, then the solar makes a lot of sense, right? You're not just hot water, but your entire house is being heated by solar. But nobody does it on. None of the houses I've worked on, and actually just look at them, they're not doing it. So it's an odd thing.
I agree.
Yeah, I'm getting a little confused with how we're going through this at this point.
Sure.
We
Definitely.
are going to hear about current REMP. And
Yes.
then at a future work session, you're going to have your expert and yourself talk about how you would change it in the future. So we're really getting the groundwork now and why some of these things may be inadequate measures at this time. So we'll have further debates about which standards to use in the future. You're just pointing out
Yes.
what you've found from the analysis.
Yes.
Thank you.
Yes, I really want to kind of give you a baseline of
Okay.
where we are and what looks like it could need some tweaking or some
Sure,
adjustment.
and I can see this sort of area that we're looking at now really broken down into a bit of a matrix that talks about, well, maybe you'll get this credit if you have this type of photovoltaic, but you only get this credit if you don't. I mean, because now there's these different systems with different efficiency uses and things like that.
Potentially. Yeah.
And so even the solar hot water would be broken into, is it just for driveway? Is it preheating hot water for baths and dishwashers? Is it radiant heat? And we would start to rate it, in finer detail.
I really believe that there are so many things like that that we could fix in the program, for
Okay.
sure, to make
And
it
so that's what
actually
we're
work
doing. We're
better
just getting
for
our
us.
baseline today to understand the changes we may discuss in greater detail at a future work session.
That was my goal. When we knew we only had 45 minutes and we really
Okay.
wanted to kind of get through this, I
Okay,
wanted to just kind
good.
of
We'll
lay
let
out
you
the
go
basics.
now.
let's
We'll let
meet
you
our
just
goal
rip
then.
through it with what we currently
That
got,
would be our
what the
goal.
shortcomings are.
If we have time at the end, we can discuss. Ground source heat pump. Currently, there's some confusion. We had an older version of how to calculate it. Now it's based on the $6.84 per 100,000 BTUs exchange. But the only way to quantify that is through an old obsolete DOS program called CalRes, which the designers that are doing this are even confused on how to give us the numbers we need to do the background on this. So this one really needs some help. And then if you continue to the next slide, the energy use, this is another quote from the consultant that I thought was interesting. The BTUs consumed per square foot per year for the 3 exterior energy uses are the backbone of the REMP calculations. These numbers were reviewed by an expert panel prior to the issuance of the changes in the 2011 code adoption. I, August, sat on that panel and believed the process in place was a reasonable application of installer experience, engineering calculation, and consensus building. The BTU per square foot for the uses were all adjusted during this review and are as follows. And the source that he quotes is Fred Perrin, who worked with CORE to put together a study. What he's saying there in kind of a nutshell was that he couldn't give me the absolute formulation of how they came to some of these assumptions. He just knows there was a wise panel that sat and
Figured it
kind of
out.
discussed and figured this out. And he still feels today that the background for that dollar per dollar exchange on the renewables is a good formula. And we can visit that as we go to the next feed. But that was the best I could get response-wise as far as how exactly did they come up with this trade-off. So that as we go into this is the trade-off he's speaking of. REMP values. Snowmelt basically consumes 82,863 BTUs per year per square foot. Spas consume 428,937 BTUs per year per square foot per year, and so on. And then if you go down to snowmelt in the commercial application, they feel it's nearly double. It's 146,228 BTUs per square foot per year. And he really just in the little note above, it says, note, these numbers were for the residential system above. The report does not quote the BTUs per square foot per year numbers for the commercial calculations or the source of these numbers. I, August, used the formulas below to back calculate the C-REMP energy values, assuming the other factors in the formulas are constants. So he couldn't even find the data to back the BTUs per square foot per year for commercial snowmelt. He assumed from the formula and backed up to that number. So those are the numbers in this formula. And here's the formula coming up next. The energy fee calculations. The fees applied to each of these numbers is based upon the following. Formula 1, which is Formula 1 dates back to the original Aspen-Pittskin Energy Conservation Code from 1997 and then was adjusted in 1999 and adjusted again in 2011. So supplemental energy, that first grouping, is that number we just saw on the previous slide, that 86,000 BTUs per year per square foot, times the second section in that formula is converting that to electrical source. So if it's gas or whatever kind of fuel you're using, that kWh over 3,412 BTUs is converting it to electrical energy. Then the 20 years is plugged into the formula, assuming 20 years lifespan of the system. And then that 0.035 cents per kilowatt hour is the cost of electrical energy per kilowatt hour put into the formula. And then this final times 2 at the end was the fact that when Randy Udall first presented this to the board in the 90s, he said, oh, let's double it. Let's make it so that renewables are offsetting twice as much for what they're consuming.
Well, that's where the two.
That's where that 2 came from, and the double for so I thought it was fascinating to kind of go back into the history and understand REMP a little bit more and know what it's doing now. The problem is, what all do we want to fix about it? And how best to do that. And that's going to take a brain trust, I think, of CORE and the consultant and the board's direction on how they want it philosophically to work. And then we can maybe back up from the philosophy and give you the math that makes it do what you think it should be doing. Because I think that's the only way we can break this down. Because right now it's been kind of adjusted over the years, and its original origins were kind of interesting too. So I think that I wanted to do this revisit and this kind of a reset of what it's doing, and making sure that it first is doing what we want it to do, and then second, can we make it better?
So wouldn't the conversion of BTUs to a kilowatt be inflationary also? I mean, that's an inflationary factor. And then you by a multiple of 2, a factor of 2, then you've, I mean.
Yeah, that 0.35 may be totally obsolete, and in 3.5 cents for BTU.
But just the conversion of it. I mean, if you take the BTU in gas, cost of gas.
Yeah, true.
And you took the BTU in cost of electricity, that's an inflator.
Yes,
It's a way
just
of
converting it.
realizing them.
Yeah. Yeah, it was a way to quantify it also, that the calculator was one simple method for everything to plug in the same way and all be based on 100% return on investment.
Right.
And that's where that 100% utilization and consumption factor comes into play, is that gas really isn't 100%, but we're treating it as if it is by converting it here into an electrical equivalency. Oh, this is so deep.
Yes, it
This
is.
really
So
deep.
Keep going.
But
We'll
I-
go a little longer.
But nobody's ever challenged that. Nobody's ever, not a contractor said, listen, that conversion is screwy, I don't buy that conversion.
There's a lot of things in here that were never really challenged to the degree maybe they should have been, so. The original REMP direction was to pay a fee equal to that of the energy used for a period of 20 years. It appears the fee was morphed into essentially the cost to install the renewable energy. The system will generate the same energy each year that the exterior system will consume each year. This should be similar in theory as a span of 20 years. So August, in his analysis of the formula, sees it as we're more trying to figure out how much it's going to cost to install the PV equivalency to the offset in dollars and match those two up. So this is a very confusing formula, to say the least. And the way it's working now, I'm not even sure if everybody's even using our calculators that we provide correctly. And so I think we're getting different input from different designers in different ways of addressing the same thing. Some are actually using the city formulas, which are slightly different than the county formulas too. And so I really have concerns that if we don't address a lot of this background data and the math behind a lot of this, that we have some loopholes in our REMP system right now.
Well, it sounds like the biggest loophole is you're letting other people do the calculation.
Yeah.
That is interesting. It is in the hands of the designer, but
Then you re-verify
we
it.
verify their numbers based on our calculator. But you're right. It is from the external.
And I think for the rent program to really be not only effective, but to be fair, the city and the county have to use the same model, the same formula.
Well, we'd hope
That's-
for that, but that's not something we can force.
We can't force, but
That's part of the
just in
discussion
terms of
with that.
education, in terms of, looking at how it's currently being done and all the flaws, and looking at suggestions from different resources, there's probably a better way to do this. So it's just as we're getting educated, the city has the same opportunity. Perhaps there's a way to get into alignment together.
We definitely would offer that up. I think there's some different philosophies between council and
That's
board of
hard to
commissioners
believe.
that could
Really?
could arise in that discussion, and even between Stephen and I think there's probably some differences in philosophy.
Yeah, I don't think it's actually an elected official's problem. I think it's staff consensus. That's what needs to be reached, and I think
Yeah.
the elected officials will go along with it.
Right.
We definitely could work towards a commonality as much as possible in the way we address these things.
There we go.
Here's one that comes up right away, house size ramp. They did away with house size ramp in 2011. We still have house size ramp. And that was a board directed decision to continue the house size ramp. So we charge $1 per square foot for every square foot above 5,000 square feet. But then on the renewable trade-off, all you have to do is install 2 kW of photovoltaic or 3 solar panels, and you offset your dollar amount, whether that's a 5,000 square foot house or a 25,000 square foot house. So there's a gap there that
Oh, yeah.
probably needs to be visited in our bigger decision. The fuel source, the city of Aspen has a special provision for electrical snow melt, but as I talked to the consultant and we looked at the math, basically everything's being treated as electrical snow melt by the formula. So I don't think we need to make a special provision. I thought at first we needed to make a special provision for electrical snow melt, but the way the math is working, it's 100% return on consumption.
Steve, you have a question on
I
that?
think the fuel source is important because there are social costs that aren't included in what somebody's paying for natural gas or for electricity. And that would further complicate the calculations to figure out what is the actual cost to provide natural gas, what is the actual cost to provide solar, electricity. And it depends on the fuel source of the electricity, of course, if it's coal or if it's natural gas or if it's from solar PV. So, but I think ideally we should take that into account if we're offsetting natural gas, which is priced artificially low without taking into account the full cost to society for that. That in effect means we're subsidizing natural gas.
Okay.
Important point. Okay, we're going to have just about 3 or 4 more minutes. If you
Last
want to pick out or wrap it up.
Perfectly
Yeah.
last slide.
Okay.
Okay. Grandfathering. Should systems replacements be related to the anticipated 20-year lifespan and prorated when being replaced? That's something I feel strongly about bringing forward, but I think if we tried to parallel with the city, I've had resistance on their side of addressing some of that. So that might be something that wouldn't be included if we started working back and forth, but I'm totally open to doing that. August, the consultant actually brought up the fact that electric heat tape is not, it's addressed only in the controls section of our RAMP program, but he thinks it almost should be treated the same as snow melt. And so coming up with a formula to do that might be something we do to present to the board.
Yeah, I mean, if all the heat tape had light bulb, was powering the light bulb, you'd be able to play baseball at night around here.
You would. You're right. And it runs sometimes year round, sadly, or
Right.
late in the season.
Right, forget about it. You can't, nobody, they forgot they have it.
Yeah.
But some of that's life safety stuff that was good.
Well, to
Heat tape.
stop ice dams and to deal with not damaging your roof. So there are
Well,
some
falling off
arguments
on your
that
head as you walk by.
need to protect your home.
Yeah.
So. The last section, site selection. Should off-site solar be considered? Is one option to toss out there. Should systems that result in less than optimal output be allowed to be oversized to compensate for their reduction? This actually is something that came up, is that we have a 93% efficiency on your positioning of your solar panel or your photovoltaic panel, and if it doesn't have that performance, then you're not allowed to use it for your offset. But we've had some designers argue that, well, if I only get 80% efficiency, can I just increase the array, have the same amount of production, but not meet the intent of the 93% efficient? And I had approved one of those systems as an alternate approach, an alternate method of approach, but I didn't know if that's something we wanted to include in the future. So. And then the very last one, site-wide BTU cap. That could be a work session in itself on how we want to do the interior and the whole site, and if that's something we want to do with the board. So that's the presentation for today, and I think we made it in almost on time.
Yeah. Okay,
Quick
George?
question. So as you're working with the consultant and with core staff, are we also able to utilize RMI as a resource at all to run numbers by?
We haven't
We
invited
definitely
them
could.
to join the team, but we could.
Yeah, well, now that we've set this roundtable, we could open it up to a few
I
other
mean,
sources.
it's such a invaluable source we have right here in our backyard, and actually they're recipients of grants that come from RAMP. We should see if we can utilize their expertise as well.
Yeah, I think now that we have some more direction and definition, the best alternatives in terms of how to get there, I think it add a lot to that discussion.
Well, but, I mean, it's fine, I don't object to it, but people aren't going to have heated couches to offset. It's just not going to do it.
I think that.
I bet they already have
Understood.
them.
The chairs, actually.
Chairs, yeah.
Yeah,
I mean, it's a great idea,
I get it.
but for resident, for application to residential and the kind of residential we have, it's different.
No, I'm just talking about the formulas, coming up with the formulas and things like that.
Yeah, the trade-offs. I would like to know what the current output of a photovoltaic panel is in comparison to the ones in the 90s when this was first designed, and to know how much trade-off we really should be providing for those numbers. But then again, if we start altering these things on current time, how often do we have to go back and revisit REMP? I think it's been a while since we visited REMP. 2011 was the last kind of update, and prior to that it was the 90s that we were updating REMP. So maybe there needs to be checkbacks to make sure the system's still doing what we want it to be doing.
Well, you have an annual BTU index, and you just base it on that.
Okay, well, we're going to have to end this discussion. I'm sorry about that, folks, but we've had as much time as we can on this, and we will be scheduling longer amounts of time when we get into the next one, because I think each item's going to have a lot of discussion. Since Connie's here, let's skip over to the staff reorganization supplemental budget request and then come back to future agendas, so she can get back to her work.
Thank you, Brian.
Thank you. I knew that was going to be a tough one.
You should have to come back for Nan's too.
Well, that'll be separate after our break. Okay, thank you for being here, Connie.
Do you want to do this, or you want me to do it?
I will let you pick it up.
Thanks, Rachel. John Peacock, County Manager. What we have in front of you today is a budget supplemental request that will temporarily add 1.5 FTE to the staff complement to be reduced over time over the next 3 years for actually a 0.1 decrease. There are a few things driving this request. One is we have identified some upcoming retirements, and we have some succession planning and knowledge transfer that we want to do in anticipation of those retirements. They both are in the financial area. One is our special projects coordinator in the finance department, Deb Nelson, has let us know that she's planning on moving on June of next year. She's been doing a lot of our compliance work and financial reporting work, has been with the county for quite some time. There's quite a bit of knowledge to transfer there. We are looking to replace that role with a financial controller position, which is very similar, but plays a greater role on compliance issues with finance policies and operations. The other retirement that is a little bit farther out, but we've identified that we'll have a longer knowledge transfer role is our treasurer, Tom Oken. And our charter actually specifies that the finance director shall act as the treasurer. That is a structure that we haven't used for some time now. But basically there's been an organizational relationship with finance and the treasurer. But what we're looking to do is ultimately, as Tom moves towards retirement, combine the treasurer's functions with the finance director functions. We're currently recruiting for a finance director. We've included the treasurer functions within that job posting and job description. And so what we're looking for is the opportunity to do knowledge transfer of the treasurer's functions, public trustee functions, and then the additional functions that Tom has taken on in terms of financing and those sorts of things. The other thing that's driving it is that the county is currently undertaking a number of large projects. I think you're all aware that we've had a lot of both deferred maintenance issues where we're really looking at infrastructure renewal and modernization, and we have a lot of new initiatives that have been directed by the board or just come up as a matter of community need. That's really brought us to really having a large number of projects. This really has put additional pressure on our internal service departments. In particular, I think Connie would vouch for finance having a lot more transactions right now than typically would be the case, tracking of contracts.
Far more complex transactions also.
And the complexity is up. I think you'd find the same talking to IT, HR, across the board. Part of what's being proposed is a reorganization of staff responsibilities. So in addition to the knowledge transfer, realigning some staff responsibilities. So we're looking to create an operations director position, which would really oversee all of the internal service departments, so facilities, finance, HR, information technology, budget, and to really be responsible for the strategic planning, the advocating within the organization for policy and procedure changes that need to be made, compliance, all those sorts of things. That'll allow us to have our assistant county manager focus on and be responsible for a lot of the initiatives that don't fall into just one department right now. Valley Health Alliance, who we just heard from, the broadband initiatives, the public safety radio replacement piece, the AM/FM translator, all of these have big projects associated with them right now. And we've split throughout the organization kind of who's overseeing those, and it's been difficult to track. And so we'll be able to consolidate oversight of all those kind of special initiatives and initiatives for the next 3 to 4 years under our assistant county manager. Overall, what we will be looking to do is, while we're adding 2 positions, which are controller and operations director, we'll be taking our current procurement officer and contract manager and reducing that position to 0.5 FTE. We actually had a new position approved in finance that's going to be support for procurement. That's working out for both the current life situation of our procurement officer, and also 1.5 FTEs better fits the needs as we're going through all of these complex RFPs and negotiations right now. That's what gets us to the 1.5. So next year, June 2017, we will have the retirement of the special projects coordinator. We had anticipated at that time that position will go away. The controller, who we will hopefully overlap with Debbie for a while, will take over the functions that Debbie is currently doing. And then we'll have the treasurer moved in under finance at that point to finish knowledge transfer and helping the new finance director see through a full cycle. And then upon the treasurer's retirement, we would not anticipate replacing that position. So at the end of the day, you actually end up with a 0.1 decrease in FTEs. Over these next 2 to 3 years, when we've got this big slug of projects, both deferred maintenance and new projects coming in, though, we'll actually have additional capacity in the organization.
Okay, well, we're going to finish this item, and then we'll hold future agendas until after our other updates this afternoon, and hopefully come back to that, maybe able to make up a little time on some of these longer ones. I'd just like to say overall on this item, I think I have, and I think other board members have expressed the desire to make sure we are appropriately resourced, given the number of special projects, the move, the broadband, airport, everything else that we've got going on, let alone the day-to-day and normal improvements to operations as we try to make them. As well as we've expressed concerns with succession planning and knowing that we, like many others, have an aging workforce. And it's nice that we're very open and transparent about those people both sharing their plans and us accommodating that transfer of knowledge and experience to the new generation. So let me just ask, is the board supportive with the plan that John has put forward to us? Michael?
So, John, this is the plan you want, so?
Yes.
Okay.
And we worked closely with all of my direct reports in analyzing a number of different options and such to come to this.
Okay, so we're not heads in support. Steve?
I was thinking about our space needs during the next 2 years. And I think adding more people we'd be all right because we removed the open space and trails from the equation. Is that
We've
Is
already
that
got
true?
folks penciled in, yeah. So we've worked that out in terms of we're going to be cozy in some spots temporarily. We're going to get to know each other a lot better over the next 2 years. But certainly we're able
taken it
to
into
accommodate that in the temporary space and certainly as we move back into this building.
Okay, so a nod of heads to support this moving forward. Thank you, John. Grassroots, we're going to take a 15-minute break and reconvene. So Grassroots TV, thank you. We're back on the air. It is approximately 3:17 in the afternoon. You've tuned into the work session of the Board of County Commissioners, and we are now going to hear a Aspen Family Resource Center Health and Human Services Adjustment Operations Budget Request. So thank you, and just identify yourself for the record as you speak.
Yeah, thank you, Rachel. So I'm Mitzi Lettingham, Deputy Director, Health and Human Services, and with me here is the Assistant Superintendent of Aspen School District, Tom Heald, as well as the Special Education Director for the district, Heather Abraham, and we have Connie is here from Budget, Nan Sundin, Director, and Lisa Yorker from the Healthy Community Fund Grants Program. Thank you so much for having us today. We're very excited to be in front of you on this exciting proposal. Essentially, the Aspen School District is requesting an out-of-cycle funding from the Healthy Community Fund. And actually, it's a partnership between the Healthy Community Fund Reserve Fund as well as the Human Services Reserve Fund in the amount of $165,080 in order to fund an executive director position, primarily, to build a pilot project, a 3-year pilot project of an Aspen Family Resource Center. So this concept kind of takes its life from the very successful Family Resource Center that we have in our valley, which is the Roaring Fork Family Resource Center out of RE1, which of course the Healthy Community Fund has funded for many years, and they have had tremendous success serving kids in their district with this model. So essentially what this is about is helping children remove barriers to academic success through being able to offer them services that support them and their families in relation to being ready to learn. So that would be any kind of service related to medical, physical, dental, behavioral, mental health, social, anything in that area to help kids thrive in school. And what's amazing is that this project has come to life after at least 2 years of at least 35 agencies who serve kids and families in our community meeting and really talking about this idea that it would be wonderful to have a resource center placed in the school district that could serve not only families in the schools, all 3 schools, but also in the community at large. So that's what we're here to ask for, is an out-of-cycle. And the reason for out-of-cycle is because this project could come to life this fall, but the school district would need these funds right away rather than waiting till our usual March in the Healthy Community Fund for funding programs. They could have this contract, get this contract ready for the fall, so they could actually hire the director and get the program started. The middle school has offered a very adequate space for this program to begin at the school district, and so things are lined up. The Healthy Community Fund staff and the Citizen Grant Review Committee are really willing to support this project for several reasons. First of all, it really does address so many of our ballot questions in the Healthy Community Fund. Many of the priorities, the first priority being protecting children and families, at-risk children and families. And as I mentioned, there's at least 35 other entities who've been involved in collaborating towards this concept. They fully support it. There's going to be a very strong return on investment, we feel, with this kind of approach to serving families. The school district is viable fiscally. The program would serve families, children and families in Pitkin from Basalt to Aspen, with services that aren't currently being provided by any one agency. And the way we see it is that the resource center would be like a hub and really knit together services for families. They would actually have that ability to do referrals, connections, direct case management, make sure that case management is being done, and those kinds of things. So also, the school district is a governmental agency, and it does have this immediate need to hire a director to get this started for the 2016 17 school year. We also think that it's a great use of the reserves in the Healthy Community Fund, a pilot project of this nature, especially when we see the success of Roaring Fork, that we have just seen that program grow and blossom and really do great things for the families down there. So it's very exciting, and again, it would be half Healthy Community Fund reserves, which we have a very healthy amount right now, and half Human Services reserves. And Connie is here, and she could talk more about the dollars. But right now, I'd like to turn it over to Tom and see what if you'd like to
I can jump in and add a
jump
little bit
in and
more. So,
yeah.
Again, my name is Tom Heald. I'm the Assistant Superintendent of Schools with the Aspen School District. And Mitzi alluded to the Family Resource Centers that grew out of the Roaring Fork Valley several years ago. It was actually in 1993 when that started to get some traction and started to grow. And I was fortunate to be working down there and providing some support at some schools and watch that particular program develop over time. And then fast forward to about 2006, 2007, and we built the new middle school at Aspen School District at that time, the big silver building you see by the football field. And there was some discussion even then that we had some unfinished space in the middle school, and there was talk then that, boy, wouldn't it be great to begin to identify a place where we can begin to replicate some of what the Family Resource Center program looks like to serve the families on this end of the valley. We weren't in a position to move at that point in time, and it just sort of sat dormant for a long period of time. And then fast forward again to about 2012 when Governor Hickenlooper signed the Keeping Kids Safe and Families Healthy initiative, and I think that provided some initiative and some opportunities for Nan and her team to go out and start to seek some additional dollars to provide tiers of support for families that wouldn't have them before. And fast forward that to last fall, and we ended up signing a contract with you guys, an intergovernmental agreement on the community response position, which was a part of this Keeping Kids Safe and Families Healthy. And you know, we brought in a part-time person to begin to just touch base with some families that we knew needed support but didn't have access to those supports. And that grew from 0 to 20 in the space of a few days. So there's clearly a great need out there. So when the opportunity presented itself over the course of a year and a half, or 2 years this past year, and talking to our service agencies, just 35 to 40 different service agencies that have they're all empires of excellence that have things that they can provide families, from mental health to medical care to dental to eyeglass to mentoring to a variety of different social emotional supports. Those agencies today exist, which is a great opportunity. In '93, that didn't exist. The problem back then was we need to grow the agencies. Today the agencies are here, but there's no direct pipeline to connect them with families. And so the idea of stepping up as a lead agency and acting essentially as the conductor of the band, as it were. You had I think there's a logic model of sorts in the presentation in front of you where it shows a bit of an orange hub as the Family Resource Center and a number of agencies around it. For practical purposes, the school district and the Family Resource would become the conductor of the band, as it were, that would link these agencies to families and try to create a symphony of support that doesn't currently exist. And I guess that's sort of the overarching background of the process.
Okay. Let me interrupt just for one kind of logistical question.
Sure.
Because I tend to think of a school or my own experience at school and the kids going back and forth around this, doorway to a great room, but how do you really link the parents in to the resource center in school? I mean, how's that connection made? Do the kids bring a note home and say, hey, I just talked to these people, why don't you come in and talk to me? Or how does it really occur?
Well, it's social networks is the primary method of communication between teachers and staff and the connections with the families. at the elementary level, at the middle level, at the high school level, so those direct social connections are part of it. Heather can speak to our tiers of support and how we reach out. And then there's other communication systems as well, of just how we make everything available to our constituents, the 2,000 plus families. But it's more than just the families that are in the Aspen School District. It's also families that are participants in the community school, and families that are participants in the Country Day program, and our private or our homebound and or homeschooled students as well. So the idea is to make this particular hub or this center available to all families, not just the ones that are attending the Aspen School District.
And so, should families come in through social services for another need, nutritional supplemental or whatever, they would be also apprised of these opportunities that are here for families, and so that's how it passes along as well, the information.
Immediately linked.
Yeah, I would add, I think we know who these families are. We see them, our counselors see them, our teachers see them. And right now it's sort of fragmented. We refer over to the buddy program, we refer over here, and then we hope the families can kind of access the services and find them. So the concept here is that if we have a hub, we can have a sort of a catchment there to make sure that we can hold their hand if they need it, we can provide additional support and not just kind of farm these resources out and hope that people are able to find them.
Okay, thank you for that. And I didn't mean to interrupt the presentation, but just a kind of fundamental.
Yeah.
Please continue.
Sure. Well, anyhow, I just gave you a brief sort of historical overview of the process and how we see the school district stepping in to kind of be the conductor, the band conductor, to kind of connect all these hubs of support that are out there.
Yeah, and I did want to also mention that it is pretty exciting for us to find a pilot project like this that we could use our reserves in healthy community, and we do have precedence on that. I don't know if the board remembers, but back in 2007, when there was a real hue and cry in the community for addiction and substance use services, we came in the summer and asked for the same kind of out-of-cycle grant request for the Right Door, and that was the birth of the Right Door in that summer. Since that time, we haven't had a project or another need, but...
Yeah, I think it's very clear that this is unique circumstances. This is not a template for all sorts of out-of-season requests from existing programs. This is an opportunity at a timely fashion to start a new program. And so it's very unique in its characteristics that way.
Yeah, that's correct.
Make that clear. George?
So, as you go forward, are there other grant opportunities, or how will it become sustainable in terms of long-term funding?
And part of that will be part of the braided and blending opportunities present themselves through some funding through the Department of Human Services. To go back a step or two in the process, we spent the last 1.5 to 2 years coordinating these service providers and coming up with some what we call an IOG, or an interoperational group of mandatory partners. It's comprised of the school, Department of Human Services, mental health, buddy programs. Nan, you could probably wax eloquently on who all the mandatory partners are. But the idea with the mandatory partners is to come in and just look at how are we providing delivery of services across the region, and what dollars are being used to provide those, and where can those dollars be accentuated. And the idea is that if the school is having contact with a family, and that family has to deal with mental health, and we can connect that family with the mental health provider at the same time, there are some blended funding opportunities that present themselves at the state level that will enhance some of the dollars. But to be able to do that, we have to track that we're actually having these meetings, that we're having a follow-up, and that we're having some outcomes that actually meet the needs of the families. At the end of the year, once you've tracked all this to some level, then you can apply for some of these additional dollars. What the IOG has done, that interoperational group, has looked at these flow of dollars and has determined that some of these dollars would be most appropriate to flow back in to this concept of a family resource center. So some of the cost of operating wouldn't come just from the Healthy Community Fund. It would come through this braided and blended approach that the Department of Human Services is using in mental health in the schools as we reach out and we grow the population of families that we're serving. That's one. Some of the other funding streams that are currently working on is some of our donor advised dollars that come through our Aspen education agencies. We have agencies within the district who are passionate about this need and would like to see some additional services provided. And we've also worked with the Aspen Community Foundation on providing some startup help as well, because it's one of their priorities through their CCI, their Cradle to Career impact grouping, to be able to reach the needs of families in a timely manner. So it's access to early childhood education, access to health, access to mental health.
And I think it's also kind of nuanced in the memo to say that when we get to the renewal of the Healthy Community Fund, there's a chance to evaluate this program because it will have been up and running for a period of time, and to see, we'll be evaluating all the needs within Healthy Community Fund and determining what the appropriate ask will be in the future, so that this would be a program that would be applying potentially on an ongoing basis like others. George?
And not to mention the fact that the school district as well would be looking at what their contribution would be. Right now, most of our contribution is either through some kind of in-kind services, facility and infrastructure support, and try to have a place available that is easily accessible and has adequate parking.
So will this be a nonprofit, a 501c3?
No,
It'll just be a program under the school?
It's the school district.
It's under the school
Yes.
district, oh,
Yes.
okay.
In that respect, it would be not unlike some of the other family resource centers we see across the state. Greatest example right now is the one that started essentially in Basalt and worked into Carbondale and Glenwood Springs.
Roaring
And
Fork.
it's part of the Roaring Fork School
Okay.
District.
Yeah, it's really a program of
Program.
RE1,
I
right,
see.
correct, yes.
So it has its own line item within the budget. It's
Okay.
oversight.
Patty?
So that's how the Roaring Fork Family Resource Center is funded, because that was a
Correct.
question I had. The other-
And they initially started with some additional dollars that were available at the state level that are no longer available.
Kick it in. It's noted in the memo too that it says staff, so we have an executive director and staff, or just the executive director?
Well, there's another position. Part of it is this IGA that we signed together last fall, where we have a staff member by the name of Erica Dries who's providing the community response support. So that would fall under this umbrella.
You have the executive director and then her part-time position. And there's another question I had. For the hiring, is it possible for the county to have somebody at the table for that, since we're putting in a significant amount of dollars to get it started?
Absolutely. We have a steering committee that operates as a part of this group of 35 to 40
Because it says that
service
person will be hired
agencies.
by the school district, and I would like to see maybe somebody from,
Oh, yeah. No,
just so
that's-
that we have
that's a
some
given.
participation at that level.
Yeah, we have a hiring process that we use, we try to engage as many stakeholders as possible in some of our key hires. And sometimes that can be as many as 40-plus people at the hiring table.
Well, we don't, that
Yeah,
makes it
it
a little
makes it
confusing,
exciting.
but
Well, and
we don't have a room big enough for that, so we'd have to cut it
Yeah,
down.
but you're all welcome. You just,
yeah, I
sunshine
think-
laws in effect.
I think that there's just a need, it's hard for parents to just work and raise their children and then have an environment at home. So any assistance that we're able to give them and make it as easy as possible for them to find those services, I think is key to having the services successful and the families successful.
Yes, absolutely. Other board comments, Steve?
Do you anticipate that there would be any cost savings to other groups, or that this new resource center might be replacing some of the functions that other nonprofit groups do right now, or partially replacing them?
There might be some repurposing of some of the dollars that come through Department of Human Services. For example, there's an acronym called FACET. It's Family and Community Engagement Team. That right now, some of those dollars have been, they go to a different service provider to execute some services. But as an IOG, we've identified that those services could probably be more effectively executed with Fidelity through this process. So that would just be a repurposing from point A to point B. It wouldn't eliminate the services of the agency at point A, because there's plenty of other things that they're working on as well. It would just be a slight repurpose. There is the opportunity, any kind of collective impact program, when you bring lots of people together with shared values, and you give them opportunities to engage in mutually reinforcing activities, that various social innovations will present themselves. That could happen here, which could eliminate or add additional opportunities. It's unforeseeable right now what that would look like.
I started thinking of it in terms of long-term funding for it,
Right.
where if we ended up through our Healthy Communities Fund doing long-term past 2018, but then there could be cost savings or efficiencies in the other groups that we're currently funding.
It would buy that cost down.
There
over
could
time,
be.
Yeah, absolutely.
Yeah, it's very true. And I was remiss, I forgot to, you all have seen on page 6 is a compendium of all of these acronyms with the explanation.
And I just was
And
CMP.
yes, I know, and so that you could, but this is a very clear, description of what these programs are. Tom's been speaking about the Colorado Community Response, or CCR, opportunity, which we were able and do have a person hired under that program. And the FACET program is described there too.
And to answer Steve's question with a little greater detail, and perhaps Heather could jump in, we recognize that when you pour support into the lowest level of intervention, it's usually the least expensive intervention, and it buys you the greatest bang for your buck. And you want to talk a little bit more about how those tiers of intervention work?
I think what we're seeing
cost
is
discrepancies?
just this fundamental need to provide support at the lowest level of intervention possible. We have all of these agencies in the community that are ready, willing, and able to serve. What happens is if families don't find and kids don't find those supports, then we end up seeing more and more issues, and we end up putting more and more expensive interventions in place. So we start to and over the past few years, we've seen kids even qualifying for special ed services when really maybe if they'd received a lower level support for them and their family, they might not have needed that higher level service. So we feel like this is the most cost-efficient way, as well as the most effective way to get families and kids to the services that they need.
Other board questions or comments? Are we supportive of this budget supplemental and the two sources? All nods. I see 2 nods.
Yeah, I think it's a significant amount of money, but I think it's money, in this case, that will be well spent, so.
I was able to see the Roaring Fork Resource Center operating for,
decades.
We have the success of that makes it easy to see this could be just as successful. So they kind of paved the way for this program.
They did.
Okay. Great. You got it.
Thank you.
There you go.
But
Thanks
we
for
still
the
have to
great
approve it at a regular meeting, right?
Yeah. It has to
So
be
you have to go to, okay, but we don't have to come back and present.
You don't have, well, we'll probably ask you here, Mitzi or Nan, to
All right.
answer questions for the public.
Okay,
It'll be probably our next regular meeting.
when will that be?
Next Wednesday, a week from tomorrow,
Okay, all right.
And
at the library.
Yeah.
Well, our next meeting will be at the library. You're in our last meeting in this poor, dilapidated room.
This is this week is your last week.
I like this split.
Today is your last day in here? Oh, my
Yes.
gosh.
Yes, it is.
Been many years.
We'll be in the library with you next week.
Okay.
Thank you.
Thank you very much.
Thank you very much, and I'll follow up with Mitzi and Ann about having representation at the table. when we
That would be
move forward
terrific,
with
thank
this.
you very much.
Okay. Well, let's go back to our review of future agendas, so we can make up that here now.
Yeah, Rachel, I just have a few items for the board. Just a reminder, this Thursday, we have the EOTC meeting. I think there is some confusion over the agenda. You all should have gotten an emailed agenda through
I got the packet, actually.
packet through John Kruger. Rachel, you will be at NACO.
Yes, I will not
We
be
are
there.
chairing, so Michael,
We'll be chairing
I think you're up
EOTC.
for chair, and that'll be across the street.
We need hamburgers, and we need pizza and beer, right, Michael?
Yeah, it'd be nice.
Let's see what we can do. July 26th, as you guys are well aware, you already said, we'll be having our first meeting over in the library meeting room. We're going to be starting to do equipment moves and those sorts of things from this room, which is what's prompting that a little bit earlier
Are
than
we
August.
taking the
We're gonna-
They
Will we
have
have
all
our chairs or not? Or do you know yet?
Well, that's a good question. We haven't had that conversation yet.
The problem is there's a lot of meetings in those rooms.
There's a lot of meetings
So
in
do
those
not
rooms.
expect your chairs to be untouched unless you bulletproof them or something.
Yeah, let's see if we've got a good space where we can store those chairs.
For a
I'm not
couple of
sure.
years.
Yeah.
We'll think that through. We'll give that one to you to think about, John.
John, can I ask you a question? Is the plumbing problem still a problem at the library?
So we were able to get the jetting, the blockage was all the way in the old piping, and so this will be an update we'll be giving you again in the future, but the plumbing is working, yes. I guess when the older pipes, the metal pipes sat dry, there was some peeling and such,
It's
some
scales,
edging,
yeah.
scaling going on in the pipes, and so stuff is getting caught on that. So we're watching that, and we're looking at options to either ream those pipes or reline the pipes right now. So, but we do have the blockage fixed, and I think it's a function of them sitting dry while we were doing the remodel.
So the porta potties are still out there?
Until we have that solution where either we ream or line, just in case there's another backup, we're having a backup.
Right, and well, those should be cleaned more often then, so.
Okay.
Okay. So we'll continue to move forward, and we will be meeting at the library next.
And then I have just a few more. August 9th is potentially turning into a pretty busy day. We just got an invite from Gunnison County commissioners. They would like to meet again, I think, on the wild and scenic issue.
Are we driving this way?
No, are they meeting in Marble? I know I just
Let me
sent you
see,
an email.
I don't remember. I just saw it.
Is this a meeting that they were gonna put together
Put a panel?
some panel?
I
Yeah.
believe so.
And,
Just for this scenic river?
Yeah, they wanted to get independent information about what does wild and scenic do in areas, how's it applied, would have been the success. I have no idea who the panelists are.
that's what I was gonna ask my next question.
I think they're having John McLeod, who is on the Colorado Water Conservation Board and also has been the attorney for the Upper Gunnison Water Conservation District for a while. And I believe Frank, who's the head of the the Upper Gunnison River Conservation District. I had seen Phil Chamberlain, their chair, at another meeting and asked him about it. And I said, well, have you considered someone like American Rivers who can talk about the experience? And they said, no, we don't want anyone with a bias
So they've got everybody from
towards,
Gunnison?
towards saving it. So I don't know who else they're having.
Okay,
This was
sounds a
quite
little biased
3-4
to me.
weeks ago, but that was,
Yeah, and I don't have any of those details even in the email. So
yeah.
right now, the invite is for August 9th, 3 to 5.
And where would that be?
The location is not listed in this email either,
Well, it's somewhere in the Crystal River
but I'd
Valley.
imagine it's either gonna be Marble or Redstone.
Okay, well, can we try to get more details on that?
Absolutely.
And then see if we can talk about it the first week of August to see if one of us wants to leave our work session early to attend that, or whether we just want John Ely or some Healthy Rivers and Streams staff,
Don't they want it all? Don't they want us there?
I think they're inviting the board, yeah.
if we'd like to, so. Okay, Michael?
It seems to me that we had proponents at the last meeting, and there were some people who had questions at the last meeting. So what purpose is this going to serve? Is this going to enlighten the opponents or the residents who have their doubts, or what's the purpose of the meeting?
I think, like I said, I just got the email while we were sitting here, and so I'm gonna need to connect with my
Right.
counterpart. I just wanted you to be aware that there's at least a request for a board-to-board meeting.
And so the
But
schedule.
it doesn't sound like a board-to-board meeting, it just sounds like a board attendance meeting, so we can listen
Yeah,
to
I'll have to
a
clarify that.
presentation. So, and so we could be informed, essentially.
That may be the case, yeah.
It'll take most of our day.
Well, and also on the 9th, we're looking at adding in a presentation from Open Space and Trails on their proposed biodiversity policy. So we'll need
Yeah,
to.
going back to both Michael's and Rachel's comments, it seems like, again, we're just being invited to a meeting to listen, unless they want some feedback again, but so maybe it would be easier for us to maintain our meeting to have some staff go over there and/or someone from Healthy Rivers and Stream.
Yeah. Well, let's get more information about the meeting, and so we can make a final decision.
Let me ask you a question. Is there any board member here who has concerns about the designation of wild and scenic?
I think there were some good questions raised about how you're going to get it through Congress and how it's still going to be written and all those things and what happens then. And I think that the offer from Gunnison County for us to attend the meeting is important, and I think we should at least have a member of the board, and I'm willing to make the trip because I'm the one who was present in a meeting with Gunnison County.
Yeah.
I think I put my money where my mouth is on that one.
But we've already sent a letter of support for the wild and scenic
Right,
designation.
well,
So in
right.
general, it seems to me we're all in support of it.
Well, Gunnison County sent a letter of support too, and.
Yeah, all the letters of support so far have been premised on kind of supporting at this stage of the process. None of them have been the full bore all the way to the end support as continued things. And as I think George pointed out at the last meeting up in the Crystal, that the next step would be, is it suitability or eligibility? I get those two confused, but to have the Forest Service to go forward with a study of suitability, which would then potentially answer more of everybody's questions about it. So let's find out more about the meeting,
Yeah, and then we
how
can
it
make a
is,
decision.
and then we can make a decision whether it needs to be a full board up there or not. What I would suggest is looking at the surrounding days on our agendas. We do have a longer executive session on the 2nd, and then we have the potential to either add one to the 10th or the 12th. So what I'm saying is we may be able to shorten up the 9th via the executive session as we need to.
Yep.
And we may be able to also do a working lunch as needed to keep the presentation with Open Space and Trails on there. So let's try to work with moving the schedules around a little bit, determine if we really need a 2-hour executive session that day or not, and see what we can do to work this around.
Okay.
I guess the last question, as you're talking to your counterpart, is this sounds like it would be a public meeting, so are they allowing time again for public comment, and how is it going to be orchestrated?
Yeah, format, get the format
And make
questions.
sure that the people in the Crystal River Valley on the other side are well noticed.
Okay, well, I got the update from Dorothea,
have
so I'd imagine
then,
that you already reached out there somehow.
Just the last thing, we had rescheduled the airport department update for August 16th.
For today?
No,
Today's just a
not for
mini
today. Yeah,
Today's
the
a
one
mini
that John's
update.
here to give.
No, it's behind the post.
The longer one, we had a longer one planned, but that's when I was out of town, we decided to move it.
I have a few.
Okay, Patty, first?
August 16th, are we ready for, didn't we just have our employee appreciation picnic, or?
Yeah, well, so we do typically a recognition lunch and then employee appreciation picnic. And we usually do spread those out.
But we moved the other one later.
We moved the other one later, and we decided for a few reasons to move this one up. One, it's ahead of all of us moving. And getting everyone separated. And we got so much good feedback on having the barbecue
Not a potluck.
Yeah, versus, well, not a potluck, and also having it later in the year where it needs to be indoors. And we don't have a place to do it indoors for a while. So we thought we'd just do two closer together.
Okay,
And,
I figured there was a good reason behind it. I also have one more. The Open Space and Trails ballot question is coming before us on August 10th for first reading, and don't we usually discuss it? Should we discuss it before it's officially coming for first reading?
Yeah, we're going to be looking at work session
Okay.
time ahead.
I just want to make sure that we had a discussion prior to that first reading.
We've had some preliminary discussions, but we'll have more.
Yeah, I just think we should, yeah.
Yeah. Okay, Steve?
The meeting in Marble or Redstone would be a perfect opportunity if we could do a video conference thing Or we could all be sitting.
There's no technology in Mars.
I don't think we have enough broadband.
There's no cell phone
Yeah.
up there.
So, you know, it's a futuristic thought, but
Yeah.
that would be a perfect application that we could all attend without spending an hour and a half driving over there
2 hours.
and back.
Yeah, but let's not make too much of it. They're spending a good 2 hours driving over to Marble as well, you know. We all have those far reaches of our counties, but let's just see how that plays out. Michael or George, any other items? Okay, just in terms of longer-term update, I have let John know that I will miss the work session of September 20th. I will be actually on an actual vacation, not business travel. And so everyone else, do keep John aware of any potential travel changes so he can be sure he has a quorum. And that some of these other presentation staffs are really asking for a 5-member board, you know, to be on the same page. So we'll keep up on that. Anything else on future agendas? Okay, I think we're done with that, and we will now move on to the Aspen Airport update. John, welcome.
Hi, stranger.
How are you?
Oh, what's this?
Thank you, Commissioners. Let me load this real quickly.
Yeah, that's great.
I need to first apologize to the Commission. I missed the last airport update and didn't take anywhere into account the level of fluidity of your agenda, so I apologize for that.
Don't worry about that.
Thank you, John, for covering for me. I got there about 3 minutes after they said it just concluded.
We are so
Yes, John was
efficient.
early today, yeah.
Okay,
Yes.
well, we have the camera here. Perhaps I'll show you. Apparently, we have just won the 40th anniversary for outstanding achievement in airport snow and ice control. We have a very good test ground for that out here. 2015-2016 Small Commercial Airport awarded to the snow crew of the Aspen-Picken County Airport, the International Aviation Snow Symposium sponsored by the Northeast Chapter of the American Association of Airport Executives. So great kudos and thanks to that snow removal crew. Here you
That
go.
is a
Pass that along.
Rare award to get.
Really?
It's a tough one to get, yeah.
Very good, very good. Thank you for that and congratulations. That should be noted at the employee appreciation.
Yep.
card as well.
We have to wait for winter to do that.
Okay, so here we go. We'll take the lights.
Shoot the
And John, if you just identify yourself for the cameras and then take it away.
Thank you. Good afternoon, members of the Commission. My name is John Kinney. I'm your airport director at Aspen-Picken County Airport. And thank you for the accolades on it. As John said, that is a big deal. And I'll talk about that in just a moment here to a little bit greater detail. But I just have 3 quick items for you today. First is staff recognition. The next is an update on the environmental assessment that we're underway. And the third item is talk a little bit about air service development in terms of what we got coming this next season and some of the terminal operation challenges. So 2 really impressive feats accomplished by the men and women out at the Aspen-Picken County Airport. First is national recognition of a snow award in snow and ice control. It's a very, very, very specialized aspect of snow removal. It's not what we do on Highway 82 or the side streets or you would do on your driveway. If you think about it, go down Highway 82 with winter snowy conditions and hit your brakes at 140 miles an hour, but don't lose directional control of your vehicle. That's what aircraft do every single day during winter operations at the airport. So from in-pavement temperature sensors to chemicals that are put down at certain times and different mixtures at different times, the men and women out there constantly monitor this and apply those chemicals to ensure they got the greatest level of friction so that those aircraft coming into and out of the airport don't have mishaps. Every winter there's multiple mishaps around the country, and Aspen-Picken County has really done an outstanding job. And this award comes from the peers, and it's not awarded every year, so it really has a lot of value to it. They'll go 2 or 3 years and not award it if it's not warranted. So very, very, very proud. I sure didn't have anything to do with it, but the men and women who've been out there for an extended period of time have incrementally improved it. So, and the second item is the annual FAA safety inspection. So once again, 0 discrepancies, which again is also a very impressive feat. We got a new FAA safety inspector this year. I thought for sure they would find something at the airport, and the challenge was on, and the staff really responded. And if you're not familiar with what Part 139 is, that's the certification that allows you to have scheduled service at your particular airport. So that's what differentiates Aspen Airport from that of like a Centennial or Jeffco type size facility, or Rifle, or in a Van Nuys, world's busiest GA airport. They're not under 139. And it specifically addresses your airport rescue firefighting, your safety procedures and protocols, your emergency response, your emergency contingency planning, planning for wildlife management, facilities. The paint they use in the airfield, you can't use on the land side. The reflective beads are not good enough at the airfield as they are on the roadway system. Asphalt mix is different. Chain link fence is different. So many different aspects of what you see at the airport, you could not use those same materials. They're very upgraded for aviation. So great inspection. Two recommendations. One is for lighting out at the de-ice pad to just illuminate the aircraft, the target, if you will, for the folks de-icing, getting the contaminants off the aircraft before it takes off in flight. And then the other is wildlife mitigation fencing. It was interesting that while the inspector was there, in fact, waiting for the staff to meet them over at the Airport Operations Center just off Owl Creek Road, he was greeted by a bear. Fairly good-sized Bruin.
We paid that bear a lot of money.
We did. And he thought at first it was someone in a bear costume. He'd never been around wildlife before.
We've never had that good a sense of humor here. Yeah.
And he saw it out of the corner of his eye, and he thought it was Phil Mraz, our director of operations, trying to sneak up on him. And he goes, "I'm not going to give him the
Did you go up and shake his
gratitude of it."
hand?
And then as he goes, "Well, he never touched my shoulder," and it was gone, and he looked over and then saw off to his left side the bear was just looking back at them as it was trying to go to the front door of the AOC. So then it turned and came back towards him, a little bit of a quicker pace, and this gentleman makes me look small. So he said, "This is one of the few times in life that I've moved at lightning pace." I got inside the car, and then the bear wanted to have more.
Touch the car a little bit.
Yeah, so then started playing on the car with him.
Oh my gosh.
3 other events while he was here for the 2 days, bears getting inside the fence and on the airfield. So he said, you really need to have some type of mitigating fence. The fence you have is just used as a ladder to get up to and over and into the airfield. But wildlife issues with aircraft is a very, very serious event. You remember the famous one, the geese taking the 737, Airbus, 737 size aircraft into the Hudson. So it is a big issue, and we'll have to address that. But again, 2 very great accolades for staff. They've just done a great job, and they've done a very, very good job on safety and snow removal.
If I could just, I got to meet this inspector on his last day, and he did tell the bear story, and it was as funny as John made it sound. But these are really serious inspections. Safety is their #1 job, and I've never heard such accolades coming from an inspector about the work our staff had done and what we had done for our Part 139 compliance. So
Thanks.
good job.
John, what is bear-proof fencing? What is that? What is that?
It'd be a chain link style fencing with the 3 strands of barb, wire on the top, probably in both directions, because once they get in, you want to keep so that they just
Because the
couldn't
fence
get
that we
over.
have there now was put in for elk, essentially, or deer.
It's really a deer elk fence.
And so
They jump over.
we're talking about replacing that with chain link fence?
Same material. It's coated in this particular area. It's green. I would suggest a black because it almost disappears. But there's a lot of it along the fixed base operated, the general aviation, for just a higher level of security.
And is it 10 feet tall, or what's the height of it?
I'm sorry?
What's the height?
The height would be 8 foot with 3 strands on top, taken to almost about 11 feet.
Okay.
Right now, I believe it's 12.
Okay. Thank you.
The next is the update on the airport environmental assessment. We have 3 meetings that are coming up here in the month of September. Next is the Community Input Committee. That meeting is September 15th. It's going to introduce the terminal conceptual designs. They're designed into about the 25 percentile. It will really be a visualization and massing superimposed where the proposed terminal would go so that folks can take a look at that and see what it does look like coming from southbound versus northbound on Highway 82, or up from a view of Buttermilk, or up from a view of Starwood. So it's a great visualization, and that's going to be for versions 1 and 2 that have moved forward. And then it's also the preliminary environmental effects that they'll also be talking about. So that agenda and presentation will be at the Community Input Committee, and it will also be that same day, later that afternoon, in fact in the evening, getting into the evening at the for the community, and it's just open public house. We'll then swing back to the Board of County Commissioners and give you the feedback as to what we heard from the community, what we heard from the Community Input Committee in regards to that terminal design, massing, visualization, and also the environmental factors. So we have not scheduled that in September, but we will get that on your agenda, if not the first week of October. The passenger backflow unit has been installed. Last time we had to show you some still pictures, which I think was a little difficult. And I'm not sure that everybody that was here was in that meeting, but it's really to separate the arriving passengers from those that are sterile, the arriving passengers, and those of the general public. So here's what that. Well, that didn't work.
You know,
That
open the
didn't
door.
work either. John, how do you get a video to kick in
Well,
on this?
usually there's a little triangle that I'm not seeing.
Oh, there we go. Do we get the now double?
Oh, go down.
There you
There,
go.
there it is.
Okay. What's interesting is this a new security camera set in, so they don't realize the camera's there. So all the facial expressions you see are they've realized they've arrived in the Disneyland of the Rockies. But pretty good throughput. One person you'll see here turn around and try to go the opposite way, and alarms go off and staff responds.
Now, did you set that up? Did you have someone you told to go the other way, or?
John,
There's Creighton Burkholder.
no, I forwarded, I gave your name to a constituent who called me. It was complaining about some very loud piercing noises. Did anybody ever contact you on that?
He did.
Was it due to this or no?
No, not due to this, but immediately to the left of that unit, here goes the person stepping back, and then the alarms go off, and then the door shuts. So in case someone's going the opposite way, they're momentarily delayed. So, and there's staff responding to it. So that door to the left, right in front now that the airport operations person is going through, is about to go through. When that closes, it's 3 chirps. And it is too loud. I had someone call me the other day and said it's just become really kind of an annoyance, more than
Because
annoyance.
staff uses that door to get in and out.
Well,
to
we're
secure-
going to, now that we have got people trained to the level that we want to, we're going to deactivate those audible components. Because it's annoying, no doubt.
Okay.
So that is the CABA unit, and obviously that gentleman is lukewarm at being in Aspen.
Grandbaby must have been there.
The third and final item I had for is just the air service developments. You know, we really have gotten a robust schedule coming in. This next season, we're going to have going to 40 for daily flights, which is an increase from the 26 to 32 to now where we're going. We're adding Salt Lake City. Delta is, which is obviously a major hub for them. But as you can see, go to the majority of major hubs. And just a footnote to that, we always want to make sure that we are very much locked in step with those major hubs in terms of our security programs and everything that we do out there, and is visible and not visible, and the layered approach that we take. The other component to not only the flight schedule increasing, but it's the current peaks, anywhere from 7 to 9 a.m. is very busy, and from 11 a.m. to 1 p.m. And this proposed season, they're proposing to have 12 aircraft on the ground. It's not that they're going to do immediate turns. You know, it's almost like, how do you fit 50 gallons of water into a 5-gallon bucket? You do so with a hole in the bottom of the 5-gallon bucket. So as you pour it in, it trickles out. And that's that same shell game that is used on peaking of aircraft. So if 12 come in, can you park 12 is the key, but do you have to accommodate the volumes associated with 12 aircraft simultaneously? No, it depends on how far out that is spaced in which you would accommodate those aircraft. We do continue to work with the airlines to really maximize their existing facilities, but we're really pushing some envelopes. Optimally, I would say 9 flights is about the max in terms of the capacity of the terminal building in a pure simultaneous operation. The sterile boarding lounge area now accommodates 7 flights simultaneously, does a great job, and has really pushed any type of capacity constraints to the TSA checkpoint. And that's really going to become your choke point, because you cannot expand from 2 to 3 or 4 lanes there. It's virtually stuck at 2. So it's throughput and helping some of the TSA folks and some of the staffing constraints that they have, as well as the check bag screening operation. We've had some discussion with the airlines. They're coming forth asking the TSA if they can increase the capacity of their throughput of the check bags. That's really becoming an issue for them. That will then have a ripple effect into the bag makeup area, which is where the airlines take the bags once TSA has screened them before they put them onto an aircraft. So there's a variety of aspects in a terminal. I kind of always say about 9 to 10 areas that really are elements in terms of what happens with scheduled service operation. Parking really has not been an issue since I've been here. Curbside isn't either. Ticketing, very busy at times, but no real constraints there. It really comes down to items 4, which is the check bag screening operation. The baggage makeup area, 4 and 5 have very much a direct correlation. The TSA security screening checkpoint, you're pretty much at a fixed capacity, and a lot of times that speed is based on threat. The sterile air passenger waiting area, I think, is working very well from all the feedback that we're getting. The aircraft parking gates is something that we could tinker with. Right now you have 8 positions. I'm a little concerned at the power in and power out approach, especially the power out. That's just asking for some issues. So
can you explain that a little further? What do you mean by power?
Yeah,
and
thank
power
you. Thank you very much, Rachel. So as the aircraft taxis into the gate, it's obviously under the power of the engines. Once the engines are shut down, how the aircraft then turns 90 degrees and goes back out to the taxiways is it starts both engines. There's no tug hooked up to the nose wheel of the aircraft like you'll see at a lot of airports. They power out. And in doing so, you're within about 50 feet. That's 440 degrees and about a 200 mile an hour wind. So jet blast becomes a real safety issue out there. Well, obviously, not very many people get within 30 to 40 feet of an engine, but it will still throw pebbles, and you look at the side of the terminal building, next time you're airside, you'll see the pits everywhere. It really throws a lot of stuff. So I'm really not comfortable at this point with the volume, and have conveyed that to the airlines, where they really just need to start bringing some tugs up here. In doing so, it'll be less emissions from the aircraft, less engine, and it'll make it a little bit more of a greener environment. So if you bring both of those aircraft in at those gates in a nose-in position to the terminal, as opposed to now they park parallel to the terminal, you can pretty easily get to 12 and safely, and have a much safer operation. So we're looking at taking a look at that and talking about that with the airlines. The TSA has also come to the table at behest of the airlines to talk about whether or not they can increase their baggage screening capacity to bring in a couple more machines. We actually do more volume in terms of passengers than Vail, and we do it with 3 machines, and they have 6. And it's a pure inline system, meaning once the airline receives the bag and puts it on the belt, TSA doesn't touch it again until it alarms. If you look in the back room of Aspen's operation, it has to be touched 3 to 4 times, physically picked up, and walked a bit distance about from here over to George. And as you're walking towards that, the 4th, 5th, 600th time a day, dodge a pole that's right in the middle. So ergonomically, they're getting people hurt in there, and the airlines are also having some problems with worker comp issues as well. So we're in discussions with them to see what problem definition could work and what options we have. And the baggage drop-off at the terminal in terms of airside, that would be a secondary ripple effect, if you will, if we did do something in the TSA baggage area as well as the airline's makeup area. That could have a ripple effect, again, all based on peaking when those flights hit. For item 9, bless you, as well as items 10, baggage claim for the arriving passengers. So these are really kind of the different operational, you push on one, you may influence one other category, you may not, but you definitely will with items 4, 5, 9, and 10.
Okay, let's hold on a second. George, you have a question?
I don't know, you're almost done with the presentation, I could wait.
That's all I had,
Yeah,
George.
So my concern is, I mean, our airport has a limit in terms of our capacity, our ability to continue to bring in service. So what you said was the plan for this coming winter is to see 12 aircraft coming in or overnighting between 7 and 9 in the morning. Is that what you're
Great
saying?
question. Between 7 and 9 in the morning, 7 and 9, 9:15-ish, it would be 7 RON remaining overnight. And so they would be staggered from 7 a.m. to about 9:15 in terms of their departures. The 12 factor would be 12 aircraft on the ground simultaneously. That's between 11 a.m. and about 1 p.m. time frame, so stretched out a little bit further.
So, but then you also said that you thought that right now our capacity is really to handle 9 at the same time versus 12 aircraft, and the security hold can hold up to 7 aircraft numbers. So it seems like I'm not sure where this is coming from. We're pushing the envelope here. And do we have any other ability to say, you know, this is our limit, and we just can't accept any more aircraft during these times? You either have to reschedule or think about some other alternative. I mean, do we have to continue to accommodate the airlines in terms of their needs and demands based versus our ability just to provide a safe, and pleasant experience for our guests?
Well, great questions. As John said earlier, and I know everyone in this room agrees, safety is always our first and foremost concern. So we'll always operate in a safe manner. If you left the aircraft configuration on the ramp as is, they would be limited about 9 aircraft on the ground at one particular time. You can not make a variety of improvements if that's a decision, and it would in some ways have a limiting factor on how many flights they could bring in. If the other I was wondering if a complaint was filed with the FAA, but I won't even go there. That'd be speaking too long with my mouth moving. So I'll look into that one for a little bit. The other component is all these variables, these 10 variables, come into play at different periods of time. So if you're exactly right, if you do the math that I just threw out, 2 + 2 = 6. So that is the variable factor, whether or not you can have 7 in the terminal sterile area. Yeah, I'd say that's about a max. If you could have 9 or 12 on the ramp, again, it just depends on how quickly you're trying to move those. If you're spreading it out over a period of time, that's how you get the 50 gallons to fit into a 5-gallon bucket without overflowing onto the floor. So all these are very much fluid variables, and it all depends on just how fast the aircraft come in during those periods of time. The choke point you have right now is you have 7 flights at capacity of 770 basically, so 490 passengers. If you use 1.4 to 1.5 bags per passenger, you're well in pushing into the 600s. That's exceeding the capacity, and that's per hour. So does that mean it's unsafe? No, it just simply means that you're going to draw the operations out over a greater period of time, and that hourly capacity is going to be exceeded. It's not unsafe inside the baggage component of the security checkpoint. It's just whether or not the passenger experience is going to tolerate an hour to hour and a half to 2 hour wait times or processing times. So
the overall experience at the airport, you know, we hear complaints all the time. If flights get delayed and you have weather conditions, and then it really starts backing up, and there's misconnections.
And George, so we don't have control over the scheduling for the airlines. I know John does make the case, about the compression issues that we have in those time frames for the airlines, because as we exceed capacity, you're right, you have the experience issue, and then you have increased risk of delay or what have you. And so John and staff at the airport have been doing, I think, a really good job of developing and keeping track of those metrics, and a better job communicating those right now, but the airlines are still making the decision as far as the scheduling goes.
But we could limit, we could just, well, we go out and actively market airlines to provide service to different markets and different schedules.
Yeah.
We could say, we can't do this with our current airport, and that leads, of course, begs the need for a new.
Yeah, we're.
Yeah. We're clearly bumping up against different capacities, and I think that it's something that on the baggage particularly, we will, as you're saying, be looking for the appropriate options. Potentially it's a new conveyor belt in the back that eliminates the 9-foot carry from one place to another, and get down from 3 touches on the bags to 1 or 2. So, I'm glad you're bringing these challenges forward, and that's what's appropriate, but they're not just being thrown out as, look, these are all problems. It's like, these are the things we're going to have to work on before we have a new terminal as well. And I appreciate the concept. There will be a capacity point, but I don't think that, I'm not interested in engaging on a conversation of who and what or how we should limit and what our legal authorities are to limit yet, when a different parking configuration at the airport takes care of the problem, at least for some of the aspects. And the other aspects, as you said, you have to go all the way down the dominoes to make sure nothing's being left unnoticed or unattended to. I see Patty's hand up, and then Steve, and then we'll come back around.
Yeah, I have a couple things. But it's my understanding that this isn't every day from 7 to 9 or noon to 11 to 1, and it's seasonal. So, because I know that you can't fly to LA every day of the week. There's certain days when, so you may have 3 days out of the week that you have more airplanes that come in at the same time, or scheduling.
It's about 115, 120 days out of the year.
Out of the year. So I think we need to take that into consideration too, when you're fixing the problem, to build everything for Easter Sunday. But George, we do get calls and we do get complaints, but we get them for everything out at the airport. So I think we need to pay attention to that and work within our constraints and see to do the best job that we can. The other question I have, and this is real quick, if you let me bring it back at the end of the discussion, it's something else that John and
You
I...
might as well do it now, because
Okay.
we're only having
I'm going to bring
11
this up now
minutes.
then. John and I were talking about the training aircraft that were coming over the wilderness areas. I called him because there were planes coming over from Eagle that were military training. One was jets, 2 jets, and one were 2 transporters that came over, flew over the Maroon Bells. I called John to see if that was allowed. There is a 2,000 ceiling for those aircraft, and also 2,000 from a fixed objects like the Maroon Bells. They were going right over those babies. I told John I just was interested. I remember that was an issue before. We didn't follow up with Eagle and reprimand the Saudi Arabians who were training in those planes, but I just wanted the board to be aware of that I did make a call to John about it, because it's a violation.
Yeah, I think that
It was a violation?
Yeah, you can't, they were flying too close and too low over a wilderness
How do
area.
you know?
Well, because they were like, I could wave at the guy when he came over my house. They weren't quite that low, but,
Yeah,
yeah, I just didn't know.
it's strong to say it was a violation, because there's no way to measure.
Well,
They know how high they are, and they can self-report, but to say they violated it is...
Well, it appeared to be a violation because of the height that they were flying and the proximity to the mountains, which they're supposed to have at 2,000.
I was down near Eglin Air Force Base, and they had bumper stickers down there that said, "Jet noise, the sound of freedom."
Well,
So it just depends on where you live.
I think they're cool, but there's a violation over wilderness areas for aircraft.
I think the important thing is that there are standards for wilderness areas, and that we
Just wanted to make sure.
remind them that we pay attention to those, and we notice if they seem to be coming close to a violation. I think that's a very important thing. I've actually noticed that myself. I'm wondering, what about the tranquility of that experience. So, Steve?
I had two thoughts from the discussion. One, the limit on, what's the practical limit for how many planes per hour? And the Forest Service on the ski lifts they allow so many skiers per hour. And when the ski company replaces a ski lift with a high-speed lift, the chairs are farther apart on it because they're not allowed to send up more people per hour, even if it's a high-speed lift. So it's kind of an analogous situation where, we'll reach a practical limit where we just can't put one more airplane per hour in because it's physically not possible. Perhaps the same with passengers per hour, with more passengers per plane. So we have to be mindful of that and keep our eye on it. And it's good, you really keep good track of all that. The second thought has to do with potential energy savings by using tugs to push the airplanes out instead of powering them out. And I'd really be curious kind of how much fuel could be saved by the airlines. What do the tugs use for? I don't know if they're electric or if they're diesel powered or what runs the tugs, but I'd be curious about kind of what sort of an energy cost savings could there be, which I realize the airplanes would get the cost savings if they use less fuel, but it could be better for our environment. And
Yeah. So that's something to take a look at going
Absolutely.
forward. Not so much as an answer now, but.
Let me kind of tag off of that for a second.
Yeah.
But if you use tugs, who staffs that?
Airlines,
The airline staff?
or their ground handlers, yeah.
Yeah, and that brings up a very important interface with our airport and the carriers, because those conversations have to be ongoing about having adequate ground crew for unloading the planes so that they can load the next plane, so they can move them out in a timely fashion. And I think that partnership needs to be front and center, and the discussion of the real needs to make sure that we're not having delays and less customer satisfaction at our airport, but it's really the personnel matters through the other airlines. So I think that's just a top priority.
Can I ask one more question?
George?
With this potential increase in terms of scheduled aircraft coming in, how does that impact, or vice versa, with GA when you look at getting on and off the ground?
The GA's probably outnumbers the scheduled service about 14 to 15 to 1 in terms of just numbers. I think it would be almost not even noticeable or measurable. It's maybe 6 operations a day. But as Patty pointed out, it's also a seasonal component.
Yeah, but that's when you always have the problems, right?
True, they both want to be in here at the same time, that's
And
true.
you have weather.
And you have the weather, and you have more luggage.
Yeah.
Great. Any other questions?
Thanks, John.
You're welcome.
Any other
We got our eye on the ball, just wanted to let you know some of the moving pieces behind the scene.
Yeah, we really appreciate the complexity, and particularly appreciate the awards you've received, the airport staff as a whole, so appreciate that.
And
We
John,
will, and thank you for funding the tools that they deliver these awards to, so thank you.
and just so you know, this is the last meeting in this room at the library, so next time you come and rush in, we're over there.
Thank you.
Okay, very good. Okay,
Thank you.
so
Thank you.
now we'll move on to our next items here, and that is board open discussion items with the Rockies debrief, the update on bike events permitted, and the special event application for the Aspen Art Museum. And I guess there's one thing on open discussion as you're setting up, I'll just mention to the board, I just received emails. Unfortunately, the Colorado Priorities campaign, which was going to ask voters to be able to keep the Tabor refunds and adjust those limits, has called off the campaign for this year. They think the ballot is too confusing as it is, or the election season, and they were worried they wouldn't get the resources in order to be able to effectively communicate and win a campaign. So That is, was about $135 million, or about $1.3 billion over 10 years that could have gone into transportation, mental health, schools, and senior services, but it will not be asked this year. So it's very unfortunate. That seemed to be the only thing that actually came out of the Building a Better Colorado campaign, although I guess there may still be one about how to get initiatives on the ballot or not. But that's definitely disappointing. All right, Mike, you're up. Thank you.
Hello.
Do we need this one on?
Not for me. No,
Okay.
I'm just talking.
Let's go ahead and turn that off. So thank you, Mike.
Jet planes to bicycles here.
Okay.
So Mike Kramer with planning staff, and sitting next to me is Tammy Cochin, who is transitioning and reviewing more special event permits with the shifts in our office with Lance retiring. And we have Alex Bruchetta and John Armstrong here from their respective departments. And George, I think you requested the debrief on Ride the Rockies event. And just a really quick background for the commissioners. We permitted the Ride the Rockies 2016 Ride the Rockies bike event. It was held on June 11th, June 12th, and June 13th. And if you remember the background on this, the organizer contacted staff and asked for some pretty hefty commitments from the county. They wanted to have a loop ride in the county where they wanted us to close roads off. And we had brought the topic to the board, and we said that's just not going to work. And they amended their application to do what they called a prologue or a VIP ride of 50 people, which was a loop ride in the county. And then their big event was on the Sunday, June 12th, where they actually had their 2,000 riders come up from Carbondale into Aspen, and we discussed the ideas between using the Rio Grande Trail and county roads for that portion of the event. And then on Monday, June 13th, they all packed up shop from Aspen High School on that Monday, and they rode over the pass into Lake County, and I think they went to Buena Vista from there on. So one of the unique things about our special event permitting is that it's all administrative unless there's a really big event that has community-wide concern, and then we bring it to the board. This one we obviously did, and we had a bunch of meetings. And the nice thing about that is that it gets out into the papers. There were a number of articles written about it. We had conditions of their approval to take actual ads out in the paper announcing the event. They had to post signs on the Rio Grande Trail announcing that this bike event was coming through, and then we actually made them work with CDOT and use the variable flashing sign to let people know that they were coming through. So those were some of the good things about it, and I think overall, if we had to characterize the event with talking with Open Space and Trails, it was adequate. There were some issues with trail marshals. And John Armstrong can speak more specifically to those. But basically, some marshals didn't show up, or they were late to their post. Intersections weren't manned in the way that they committed to, and that created some frustrations for Open Space and Trails, and John can speak specifically to that. And then as far as cyclists and motorists interface or any conflicts, we've got Alex here, and he can speak to any of that. If any of the issues going over the pass or any of the issues coming into the county were of issue.
Other questions for Mike? John, why don't we hear from you with the concerns of Open Space and Trails?
Well, thanks. And I remember when we met in this room the last time with Ride the Rockies, and there was quite a bit of concern from commissioners, and especially two commissioners were very concerned about the constraints of the lower Rio Grande and the basalt mass area above Holland Hills. And that was my concern too. It's a 8-foot wide trail. Most of the trail had pretty good sight lines, but there was one spot in there that I was quite concerned about the safety. It's a blind curve, and it drops down steeply, very short, but steep and blind, and two curves in it. And so really my endorsement of the event being on the Rio Grande at that point was all predicated on them marshaling this spot. And as Mike said, they did not, and we spent, Price, Hadley, and myself spent about an hour and a half marshaling that. And in that time, we saw a lot of people, a lot of riders coming uphill into the blind curve in the wrong lane, which is exactly what I was concerned about. So we manned it until actually Chandler showed up. I called him on the phone. I said, you have got to get somebody up here. And
Who's Chandler?
He's the director
Okay.
of Ride the Rockies. So so we did fine them. We wrote them a citation for that failure to marshal, because that was a very big concern. Chandler was out there 2 days previous to the event, to that exact site, and so he knew where it was, and he apologized for it. But so that was a concern. And then after it got at that point got marshaled, I did ride down the Rio down to Emma, so just to experience what our public or tourists would experience if they're riding into the Ride the Rockies. And frankly, I think that an 8-foot trail is just not wide enough. I don't think a 10-foot trail is really wide enough. People were great. Participants of the event people were having a ball. There was a lot of focus on Basalt High School, where there was an aid station, so it was kind of a big party there. And people were nice, but human nature, riding abreast, I had to bark at several people to get them to yield to me, and so that's a concern to me. So I would not permit a tour. If it's up to me, I would not permit a tour riding downhill in the Rio Grande. The fact that they're riding uphill certainly mitigates some of that speed concern, but for Bike Tours Colorado, when they were coming through last year, they're coming downhill, and I just can't sign off on that. I hope Alex can see my point on this, but I was very grateful that the SO allowed the tour on the county roads, and that's where I think the tours should be. I think they should be on the county roads. I was kind of surprised that CSP would not allow the tour on that section of 82 that was discussed, because a great part of the Ride the Rockies is on state highways. Mm-hmm. And for them to say we had to shut down the state highway if we were going to have the event there, it just didn't make sense to me. But yeah.
Yeah, you know, it really strikes me that, you know, you do everything you can with the permitting and getting the appropriate conditions for the safety of the public and the safety of the participants. And then if those commitments aren't fulfilled entirely, you know, what do? The event's over, the permit's been issued, you know, I mean, maybe it leaves a bit of a black mark for them if they come back and apply in the future. But on the other hand, perhaps our permit system should have some penalties in place that says that, you know, if the marshals are not at all their stations at a certain time, X will be the fine or Y will be the fine, and let participants know that I don't want to have them think, well, we can just buy our way out if that doesn't show up. But on the other hand, right now, they can just not show up and there's no consequence whatsoever.
You could stop the event.
And well, that's hardly not likely to happen either. What are you going to do, send 1,000 people somewhere else on their bike?
Either that or get them to comply with the guarantees that they gave us.
Well, I know, I agree with what you're saying. What I'm saying though is for the 2,000 participants at one time saying stop here, go somewhere else, that would just be chaos.
Well, I do understand that, but it's better than having 2,000 people crash on that site. That's a site of known accidents in that section of the trail. We've had issues with the blind curves and the steepness there, and the fact that the organizer was out there, understood it, and wasn't really careful to have that manned appropriately. You know, that's bothersome, because, you know, we trust what they say here.
Yeah, and I was just trying to make an example for any permit. You know, there should be conditions, and if they say they're going to shut off at 10 and they go to 11 with the noise, there should be a financial cost to that, as opposed to, well, we'll be mad at you next time you come in. George?
What I take away from this is that an 8-foot trail just can't accommodate that many cyclists. This past weekend, I was riding up Valley, and the Aspen Valley Marathon runners were going down Valley. And it could have been an issue if you had more cyclists on that path at that time. It's a great trail, but it's not wide enough to handle these large events when you have normal, everyday use on it.
Well, and we did there was a financial penalty, if you will, but it's $100.
Yeah.
And we are vigilant about writing that first offense, because then the next time it's 500, and then the next time it's 1,000, which still for a huge event, I don't suppose that's a lot of money, but I believe Chandler, I think he likes to I know he likes to run a good event, and hopefully he's taken it to heart. But.
Yeah, no, and again, I was speaking more broadly about special events, and then, you know, I think we should look at that, and then we should look at perhaps even being able, if we end up with additional personnel to assure the safety, that we bill back hours, you know, of expended staff time that we didn't expect to on the day of the event. Michael?
Yeah, I agree with George. I don't think the trails will have large events. I mean, really all you need is 5 people coming downhill who won't yield right away. And what tends to happen, at least in my experience, is that people in groups tend to think they're immune from single file. And so it's difficult on the trail, even on a summer's day, to get clear passage sometimes
When it's not an event.
without sort of contorting your handlebars and hoping for the best. So I agree. I don't think the Rio Grande has the capacity for large events and shouldn't be viewed as such.
Yeah, I agree with that sentiment in general. I think it's just always kind of hard, not randomly, but saying, okay, 601 is too many and 599 is enough. You know, finding that discretion point would be very hard. And some may say, well, we'll take care of that by having alternate launch times. So we're just going to launch 200 people every 20 minutes or something. So, you know, but again, I'm not disagreeing. I'm just saying I realize that where is the line between large and medium? So that's a tough one. Steve?
Yeah. John, how long did it take the 2,000 bicyclers to get by the Rio Grande portion? Because they were spread out, they didn't all leave Carbondale at the same time.
I would say maybe 5 or 6 hours, something like that.
Minimum.
And we thought the good thing was the fact that the riders, the tour went up through Missouri Heights, and so that it would get more diffuse.
Mm-hmm.
But it was still, there were a lot of riders in large groups, and they're having a great time. I mean, it's a wonderful event, but is it appropriate for...
So compared to a really busy day of just recreational use, groups riding to the Woody Creek Tavern or whatever, how did it compare to a really busy day without an event going on?
Yeah, that's interesting. I'd say no comparison. It's pretty big.
Way more busy than that. Okay.
Yeah, it's pretty big.
Thanks, John. Okay.
And
thanks.
just to remind the board too, it was 2,000 cyclists that they had represented to us.
Yeah.
Mm-hmm.
So are we mixing together the bike event permitted and the Ride the Rockies debrief at this point?
I don't know.
Well, I wanted to hear from Alex.
Alex, yeah.
Yeah. I mean, no, I was just wondering, we're kind of mixing and matching.
I don't have much to share. From a public safety standpoint, we had 2 deputies, as we promised, out there, one in Emma and one on River Road up by one of the 8 stations. We had the variable message signs out, social media as well. We didn't really have many complaints into our office, into dispatch. From my perspective, I drove actually the wrong way on River Road on Sunday afternoon, and a lot of bicyclists coming up, riding 3, 4, 5 abreast, and politely rolled my window down and asked them to move over single file. So I think the biggest issue there was probably just that lack of adherence to the law of riding single file. So that
social
people
event.
can go by. Right,
Yeah.
exactly. From our perspective, I certainly understand the issues that John had, and thank you for taking care of those as you did. And no real major issues to report.
Okay, George?
And so, no problems or issues going up the pass?
Not that I heard of. We had 2 deputies and an ambulance stationed up there the entirety until they made it over to Lake County. And my understanding is it went just fine. And it's sort of a more compact area too. I mean, there's one lane going up, and they had 7 or 8 state patrol motorbikes, and there were a lot of law enforcement in one small little area.
Great. Well, additional questions or comments, if you wanted to, Mike, to go back more into that larger update on bike event permitting in general?
Sure.
Or permitted, as it says here?
Yeah, and it was, and I was aware of the agenda item, and we printed off, Tammy and I, all the events that we had for the calendar year, and in fact, we went even into last year too a little bit. But as far as cycling events, actually I'll back up and say that we permit all kinds of events in Pickens County, from the community potluck dinners for the caucuses, all the way up to the Pro Cycling Challenge and X Games, which are our largest events. And as we all know, Pro Cycling Challenge isn't happening this year. But as far as a total for all events, that includes all the commercial film shoots and hiking and biking events and community potlucks, they total 28 so far for this calendar year. 9 of those 28 are cycling events that we have or will be permitting. Of that 9, 5 are mountain bike events that utilize our county trail system. And then 4 of those 9 are road bike events that utilize Highway 82, as we just talked about in Ride the Rockies, and then our county roads then also. So that's the status on those, and if there was a specific event or if there's just general discussion, I can try and answer questions or concerns about that.
Are we done yet?
What's that?
Right, like the rest of the
Oh, how
summer.
many more? That's a great question. Just give me a second, I can add that up.
Definitely not.
So we have 4 more bike events that have applied and are in review right now.
And what sort of numbers are those other events? I mean, Ride the Rockies is obviously a huge number.
Yeah, it varies. You know, there are some of the very small events that are fundraisers that have exclusive price tags involved with them, where you pay a lot of money to do a benefit for whatever the benefit is, and sometimes those rides are only 50 people. Some of the bigger ones, for example, like the Coleman Foundation does their Ride for the Cure, although they have not applied for a permit. I don't think they're doing it this year. They have had upwards of 500 people in that event, and correct me if I'm wrong on that one, but I didn't see a permit for that one yet.
I think they're Ride for the Cure.
Yeah.
I think that's for August.
Oh, is it in
Yeah,
August? I'm just
you have
skimming
it in
through here.
August. Yeah,
Okay.
sorry.
Yeah, it's
These are-
usually later.
These are out of order.
Yeah. So that's how it varies, and then we definitely have our 1 to 200 person bike events too, and you know, our road capacity is something maybe that we should talk about when we have these events. Over the years, we've certainly in a staff level had a discussion about how many bikes is just too many bikes at one time for an event, and we've loosely talked about the number 500 before, but that certainly is not, you know, a set policy. It's not a codified
Kind of
standard.
depends on the road.
It does.
You know, that they're considering.
And the time of year.
And it gets into discussion about whether they all start at 8 o'clock, or is it 8 o'clock and 10 o'clock, or which roads they'd start out at. So those are all things that we consider and talk about, but our number one criteria for when we are reviewing these are that they are safe, that we have a safety and operations plan that includes some type of discussion or verification that there's medical first aid kits on. We require that there's communication with our dispatch department so that when we're high up in Capitol Creek Road or Castle Creek Road or Maroon Creek Road, where we don't have cell service, that we at least have radio communication with dispatch and with Alex. We require insurance to protect the county in case there is some type of incident that happens that goes above our county protection. So we do require that. As you know, you operate as the liquor board. So we have a lot of events that have liquor, and we require that permits be granted and get reviewed for that too. So it's really a wide breadth of departments that get involved in these special event reviews, and they do take time and they do take energy from staff, but we work through them all.
GR, I see you're here. Did you have anything that you wanted to add based on what you saw during the use of the county roads?
I think that moving forward, we may want to expand the requirement for notice. I don't know what the event was. I literally, on my way out of the office, I got a few questions about what was going on Castle Creek this last weekend, and whether or not that was an organized ride or not. And I'm not sure, we haven't, but just the difficulty that the traveling public has going up and down with getting around bicyclists going up through those areas is becoming, more events that we have, the more we're going to have that issue.
Thank you for that. Steve?
I was wondering about the Aspen Cycling Club has these races that are late afternoon. Sometimes they come up Capitol Creek. Do they get permits for those?
They do, and actually that was one that Tammy worked on too.
Mhm.
She can speak to that.
And that is one that we did actually get comments from the neighborhood up there, the HOA representative. Unfortunately, the comments came in a day after the comment period, and we had already approved the permit. But there was concern over access and emergency access being blocked, and we do always condition the permits that, no emergency access be blocked, riders ride single file. But I think the residents up there are reaching their threshold of what is acceptable and safe.
And there's just so many.
And would they be noticed to the caucus area as well as the homeowners association?
Yep.
But they need to respond in a timely manner.
Right.
And we need to get the applications in a timely manner.
Right, and that's another issue, is that the applications might come in, a week or two before the event, and then there's enough of a window to allow for those comments, so, yeah.
I think that's another issue we need to look at in permitting in general, is, like the Mine Party for Food and Wine, they do it every year pretty much, and they come in like the week of. And I think we need to talk about that in a further discussion about.
I agree with that, and I often say that it's about having the right series of incentives and disincentives, and maybe if you've applied 6 weeks before your permit, your staff time, we have calculation, try to recover costs, is X, but if you've waited to within the last 14 days, you pay a late fee. I mean, when we register for conferences, you early bird rate and late registration rate. And, because it can require a lot of, unscheduled staff time that you suddenly have to put into something that's just new and flopped on your desk. So I think we should look at whether there's a financial incentive, disincentive for people to not
But the caucuses have no time to respond if it's late.
Yeah.
You just have to have a long enough period that everybody can be noticed.
Yeah.
Because they operate essentially on a monthly basis, so it has to be 1 or 2 months ahead of time, period.
We need to look into that.
So we should, at some point, be able to get notice out to the various concierge-type companies who organize these, and then I'd say to past applicants, because we have a pretty good list of people who are likely to repeat about those concerns.
People go down the Grand Canyon, apply for a permit years in advance, so there's a precedent for it, because you're trying to protect a resource, and you need to have that permit in place ahead of time.
Okay. How many bikes on those commercial bikes that they pull up at Heron Park and they all jump off and ride down the Rio Grande? Do you know how many bikes are usually in there? Because it just looks like total chaos when they're getting off the trailer and trying to figure out how to get to the trail, which is right there.
They're trying to figure out how to bicycle.
Yeah, and then some of those people like me should not be on a bike, and I can really relate to that. But do we know how many of the maxes that because they ride in a herd?
Yeah, I don't have the answer to that. Maybe John knows.
For Blazing.
Yeah, Blazing Pedals?
Is a popular one, 10.
Okay.
Okay.
It seems like more chaos than that.
May have more groups
Yeah.
leaving at once.
We want to make sure that they can get past. We don't want 20 riders in a row,
Yeah.
that we can get past them, so.
Yeah.
Okay,
Thank
so
you.
then we would move on to the special event application for the Aspen Art Museum.
Okay, yeah. And this was just an update to the Board of County Commissioners, and
Thank you.
Thanks, guys.
we have an application from the Aspen Art Museum, and they are represented by John Paul Schaefer, who actually attended today. He's in the back.
Okay.
And we just wanted to update the board of what the happenings were. On August 5th, the Aspen Art Museum would like to utilize Ski-Co property at the base of Buttermilk, and it's their parking lot to hold their fundraiser event. And there's a long setup time. This is an event for a number of people. We have 650 people that are planning to attend this party. And they would start setting up on July 27th. The event would be from 6 until 10:30 at night on August 5th. I'm not sure what date that falls on the calendar. I think that's a Saturday.
That's a Friday.
That's a Friday, okay. And then on August 9th, they would dismantle. And the reason we're bringing it to the board is because The Aspen Art Museum was pursuing a special event permit with the city of Aspen. That didn't come through for them, and they are looking at utilizing the Buttermilk parking lot on Ski-Co-owned property for the event. And it's very visual. It'll be a long setup time, and then the event itself, and then a long dismantle time. And we will all see it from Highway 82. So we wanted to make sure the board was aware of
Are
that.
they doing a tent in the parking lot?
Huge
They
tent.
are going to be doing a tent in the parking lot, yeah.
In the Ski-Co parking lot.
What's that?
In the Ski-Co parking
In the ski company parking
Yeah,
lot.
we need to be very sure, to be very careful that they do not overflow into our parking lot there.
Mhm.
Because that's limited parking anyway, and it's not really to be used for fundraisers.
Tell that to the X Games.
It is limited parking, and they have put, if GR is still here, he might have walked out, they have put a request for day of parking at the Stapleton parking lot. That's the one that the county owns. And GR is working with them on hashing out how many cars there would be and what day of parking would look like for that.
I'm not sure I can go for that. Parking in our, is that acceptable underneath the very strict provisions of the use of that parking lot? I just don't want to get us in trouble, because we had a lot of trouble getting
Yeah.
that parking lot.
We have made limited time exceptions for other special events, like, you know, as Michael mentioned, the X Games and such, and we have deemed that to be appropriate as adjunct to the use of the ski area. And the ski area's plan with us does anticipate having these types of events.
Do you know what their transportation is going to be for 650 people? Because that's not going to fit in that parking lot.
Yeah. They do have their permit application. I haven't gone over it in detail, I have to admit, but we will require transportation to and from the event, especially since they'll be serving liquor and beer and wine there. And just on a side too, on that topic, beer and wine and liquor obviously is permitted through a liquor permit. And in this case, we have talked with Jeanette, our clerk, about the use of the Bumps liquor permit for that area. So that's why you're not seeing a liquor permit in front of you as the liquor board. And Jeanette and I went over the map where, you know, we approved a liquor permit for the premises there, and that included the parking lot for this. So they'll be working under the Bumps liquor permit.
Can I
So,
just,
I'm sorry.
Okay, Patty, and then Michael.
I just want to finish real quick.
Uh-huh.
Init Aspen has been, is aware of this, so they're not a conflict with any event they may have right next door. I think that they need to know about this. It's a significant event.
Yep.
And the West Buttermilk Homeowners Association.
Yes. Yes. We finally have a complete application. John Paul was working on figuring out the site and the difficulties of where to put the tents and all that. So we do have a complete application, and we will be referring it out to all those homeowner associations. There is one thing I want to add on this event permit. The applicant has...
No fireworks.
Better. The applicant has requested, and we wanted to bring it to the board, the use of a Ferris wheel for the event. We don't obviously have any standards or conditions or really any policy on Ferris wheels for events.
Can we develop that policy?
I think this is going to be a one-off, but.
I think you got to ask the FAA if we can put a Ferris wheel at the end of a runway.
That's a great point, yes.
Especially lights and cameras and distraction.
I'd rather see a roller coaster.
It could be a roller coaster if there's a jet there, let me tell you.
Okay, yes.
I think
That's
that's a critical issue.
That's a really good point, and we will talk to the airport about that one. And just for perspective too, the X Games, when they do set up, they do receive permits for the scaffolding and the big camera towers that they do put up.
Right.
So it is not unprecedented for us to approve large, tall structures with events, but this will be very visible from the highway, and I can anticipate a lot of phone calls to the county on what's going on.
How much a ride?
Yeah, guys, everyone's talking without raising their hand. Poor George has been trying for a while.
Can I tag on real quick? So it's going to be a circus. Is that what you're saying?
I assume that the participants at the special event would get to ride it.
Okay.
I don't know if they'd have any circus animals or anything
I
else.
just
but-
wanted to clarify that.
Carnival.
Yeah.
Okay. Sorry, George.
Yeah. George and then Michael.
So, like, how long, what's the span where the tent or the tents will actually be in place, and how big are they? And then the request for a Ferris wheel, how long is time span? Are we looking at that?
Those are all really good questions, and I know this is a work session, and I don't know if the board wants to hear from the person who submitted the application, but I would hope that those specifications could be provided if
I
you
think
guys
it's
want
like
to talk
3
to the
weeks.
applicant.
Yeah, why don't you come
Would you-
forward,
yeah,
introduce
absolutely.
yourself for the record.
John Paul Schaefer, Deputy Director at the Aspen Art Museum. Thank you for having us here today and for your consideration here. Ferris wheel, it's a one-day deal. Takes 4 hours to put up. It's basically on a flatbed trailer. It pops up. It'll be up for the 5th. It'll come down either that night or first thing the next morning and be gone. So that's the Ferris wheel soup to nuts. Also talking to Ski Co to see if they're willing to have it. We'll work with Mike in terms of FAA, completely understand that. The tent structures will begin to be visible to the public beginning on or about the 27th, depending on how the load-in goes. They will be up through the 5th, the night of the event, and then we'll begin the deconstruction process, which we hope will end no later than the 9th. Because of an existing commitment by the Aspen Skiing Company, we're forced to stop work at 2 p.m. on Saturday, which is causing us a little bit more of a delay. I would like to add that the footprint for this event is no different than what we had been doing in the city, particularly for the last 2 years. So we're literally picking up a bunch of tents and decks and dropping them into different locations. So from the safety, the installation, the planning, the emergency responses, the security, the food service, the alcohol service, this is all stuff that we have been doing for over a decade with this event. So we're not necessarily reinventing the wheel, we're just putting it in a new place.
Reinventing the wheel, no pun intended.
Yeah, well, the Ferris wheel will really help me reinvent the full wheel.
Make sure FAA
Do
is
you have an
okay.
idea of what the height is of the Ferris wheel?
The Ferris wheel is 50 feet high. The tent, at its tallest point's a little bit shorter than that. None of the tents exceed about 30 feet. They will be all consolidated on the lot. Under Ski Co's control, closest to 82, as you're looking at sort of the 4-lot profile in that area. It'll all be tucked into there.
George.
Okay.
I just imagine all the kids that are going to be calling us.
Well, you know, it's been a very, very long time, but I recall attending the Art Crush when it was way up in McLean Flats and off of County Road, and you had a lot of kind of traffic and then traffic late at night on the rural road. And so for me, seeing it closer in and near where you already have either shuttles or public transportation and, you know, availability of taxis and cabs makes a lot of sense that way.
And if I may interject, there was a question about transportation earlier. We're scheduling a shuttle service from Aspen that has a capacity of about 350 people.
An hour or?
350 in one trip. We're hoping to make a trip in 20 minutes, so that would mean 2 trips to get the whole party out there. Interestingly enough, this is a 600-person event that used to be on Rio Grande Park. We only parked about 100 cars in the Rio Grande parking garage. Most people used feet and an existing shuttle system to get to the event. We're trying to replicate that very much, and in all of our communications are really talking to people about let's not valet park out at the event, let's park in town, take our shuttle system, we'll get you right back here safe and sound. That being said, the use of the county lot would be for the limited valet parking of those 100 cars. We have talked to GR, he feels as though that was an acceptable use, and I believe he was in fact not actually going to permit it, but
And so as you said, or as it was described, it was, quote, day of use.
Yes.
But it sounds more like late afternoon, evening use?
It would
If that's going to be the valet
That is
system.
correct. Valet opens at 5:30.
Okay.
We'd be out of there by 10:30. So it's really just evening use, and we're working with Ski Co with their existing lots and nooks and crannies so that staff, volunteer vehicles are not on those county lots at the same time.
Okay, and so people who might be using those lots for transit during the day, there won't be anything to block them from parking, and you will be able to use what opens up as they've left from the workday. We're not going to tell people no parking in that transportation lot during the day.
That's actually a follow-up question we have with GR right now as to exactly how he wants this operation to work, because we do anticipate needing that volume of spaces. So we would like some assurance that they would be available so that we don't have to start parking in other places or, you know, that aren't acceptable. That is an active question that we're working
Well, let's
through.
try to get GR to get some sort of sense about how many folks seem to be using that lot for transportation now. I don't think we want to be bumping transportation. And it looks like a planning and zoning meeting is coming into the room here, even though it doesn't say that on my
Yeah, it does.
agenda.
It's on the back of the-
Oh, it's on my backside. Okay. Well, if it's on the front, I didn't see it. Michael?
So just a question, is the intercept lot going to be used as a shuttle point? I mean, why would you park in town when you can park at the intercept?
We're discussing that. We were trying to assess how many people we have outside of town. We have a lot of out-of-town people in hotel rooms in town. So that's our first priority, is to move those people without them renting or using their own vehicles, getting them onto shuttles. We're canvassing our guest list to see if an intercept lot shuttle would be used effectively, and that's something that we're still working through.
Okay. So the board has no other questions. Mike has heard our concerns to see that they're answered during the permitting. And other than that, thank you very much for attending in person and being able to answer our questions.
My pleasure, and thank you again for your consideration.
If there are no other items that need to be brought out during open discussion, I will adjourn the meeting. Thank you, everyone.
Michael had one.
Oh, Michael,
It's
you did
okay,
have
it's not that.
Okay, just because P&Z is already here, we can bring things up. Great, thank you very much.
Last meeting. Oh, God, kind of